sure that they have the ability to share screen. And can I maybe get one at a time to share your screen, okay, and just run through your slides quickly. You don't need to speak, but basically to make sure that on your end you're able to share. Okay, so who would like to go first? Who would like to share screen first?
I don't have any slides.
Okay, no worries. Okay.
I have.
Yep.
Maybe I can just share first. Let me try to find the button.
Sure.
Let me know when you can see it.
Yep.
Can see it?
Cool. We can see your slides. Okay, cool. Okay.
Yep.
So your slides and share screen is working well.
Okay, let me stop sharing.
Nice. Okay. Who else would like to share screen?
I'll go next. Yeah.
Okay.
So.
Cool.
Can?
Yep, we can see. Yep. Okay. Anyone else would like to quickly share? Okay. Well, I think if there's no one else sharing, I'm just going to quickly just go through, in 5 minutes what we're going to be quickly doing. Okay. So I'm going to welcome basically the participants. Start with saying welcome, and then I'm going to introduce Eugene, okay, to come over to take over. So the couple of slides that I'll be sharing will be this. This one is this. Well, this is for us to rename ourselves. So this will be the slide they will see when they come in, okay. And then what I will be showing them as I explain. How to ask Q&A and things like that, some of the housekeeping. I will show this slide, how to ask a question during Q&A. It's for the participants to use the chat function. And then I will be showing this slide, okay, which is track B and the moderator and the panel. And I will actually stay on this slide, Jean, as I introduce you, okay?
Yeah, actually, we cannot see your slides.
Oh, you cannot see it. Sorry. Wait. Did I actually share? Oh, silly me. Okay, who can share screen? All panelists, only hosts, advanced option. What happened? All panelists. Why can't I share? So weird. Oh, okay, wait. Okay. I think I can start sharing now. Can you see?
Yes.
Okay. Okay, so I will start with this screen. Okay, so I'll just basically tell the participants a few housekeeping rules. And then as we go to the Q&A, I will share this screen just to let them know that, if they want to ask questions later on, is to use the chat button. Then I will introduce you, Jean, okay, using this screen.
Okay.
But I will actually leave this screen on while you introduce the rest of the panel.
Sure.
Okay. And once you introduce the panel, once you finish introducing everyone on the panel, then I will basically stop sharing. So it goes back to you again. Okay, so then the actual, panelists and yourself, you'll be doing the introduction, the discussion and things like that. So prior to the Q&A, that means once the panels have done their presentation and the group discussion and questions from yourself, before the Q&A for the audience, I would you can either remind them to use the chat function, or I can interrupt you if you want, just to remind people to use the chat function. So which one are you more comfortable?
Yeah, you can hop in anytime. It's all right. Now, when I introduce the speakers,
Yes.
do I just do it all in one shot and then they will do their presentation later? Or did you want me to introduce one person and then the person does his or her presentation and then I introduce the next person and then...
Okay. Which format are you more comfortable with? Because we only have...
Yeah, I think I will just introduce everybody, and we'll let the speakers take their turns to come on to kind of share the presentation. So we have less of a toggle back and forth
Yes,
for this part.
I think great idea, great idea. So we'll do that. So after the Q&A, okay, I think what we then go through is to actually, after the Q&A, we would have the presentation prize, right?
Yes. So what I can do,
The special segment.
yeah, Vincent, if you actually want to, so maybe after I introduce the track B panel, what I normally do, I would also just give a very brief overview of the agenda. So I would say, we'll have
Okay.
each panelist do a 6 to 7 minute presentation,
Yep.
after which we'll have about a 20-minute group discussion. And towards the end, the audience can plug in your questions. And maybe when I say that, you can just show that slide. Yeah, perhaps you can just show that slide.
Yes.
There'll be some time. There'll be 10 minutes for Q&A. And then after that, we will have a very special segment, which is the Healthcare FinTech Alliance Prize Awarding Ceremony. So we'll leave that towards the very end. I think we can, so I'll just go a quick run through so the audience kind of knows what to expect.
Okay, cool.
Yeah, and then I think after the Q&A, you have this virtual photo. We'll ask everybody to do a virtual photo, and then we will do the special segment.
Yes. So after the rounding up of the comments, okay, I will invite you all to basically smile for the camera. Okay, if you want to do something cheesy like thumbs up, I think it's cool. But if you want to be all serious, we don't need to do a thumbs up. And then I will basically do a quick introduction of the special segment. Okay, just say a few words. Then I think the next one will be a video. Okay.
Yes, I have the.
And then I'll introduce the speaker. Okay, Mr.
Srida.
Okay. And after he speaks, then I think I will invite you back again, Jin.
Okay.
Okay, to basically for the prize presentations, and then after that, maybe we are doing a presentation as you are giving the prize. I don't know how you do it. You might want to them the whole a couple of seconds to post on pictures or whichever format you like. Okay.
They rehearsed for it already, so they practiced the prize giving and the receiving, and the winner will actually hold up that mark check, and I think there will be a freeze frame for everybody to take a picture or something.
Okay, nice, cool.
Yes, and there will be, I think, a 1 minute Hall of Fame where he will just do a pitch about his business, and then I will pass it back to you to end the entire session.
Ken, so no problem. So anytime I want you to basically get you to step in, Jin, I will just refer back to you. So at least it's not like a bit of an awkward silence where no one knows what's happening. So I think we can do that. I think it's going to be quite casual. Okay, in the sense that we are prepared for it. I know that it can be a bit of a stressful day. Okay, for everyone as you're preparing for it. But let's do this. Okay, and just do this to the best of what we can do, and just enjoy the process. I think also, is there any questions that maybe the panelists or yourself, Jin, would like to ask? We've got the support team at the back, so they are constantly listening to our conversation. So if there's anything that you need to ask, any clarification, now is a good time to do it.
Hi, Mark here. So I'm guilty of missing the other rehearsal. So do I get it correct? It's like 7 minutes of intros/talk time at the beginning. After that, all of us take our turns, right? Thereafter, it'll be like we're in the hands of Jean, right? In the mercy of Jean, right? On those difficult questions by yourself or the audience. Yes, that's the format of today's fun session. Yeah.
Yes, pretty much. So during the group discussion, I will just post the question, and it's open to everybody. I probably won't single out anyone unless there's something because we did the dry run, and the panelists kind of picked out the questions that they feel comfortable answering. So those that they felt like wasn't suitable, we will skip those. So I think you're in good hands, Mark, not to worry.
Well,
comforting. Thanks, guys.
Yeah.
Apparently, there is a timekeeping function. No,
Yes.
I'm not too sure whether this is from the support team. There is a bell, okay, or a little thing, that happens at 6 minutes. Okay, then again at 7 minutes, that says that time's up to keep everyone on time, on target. So support
Okay.
team, are we still doing the bell?
Yes, yes. Let me turn on the app. Hang on.
Maybe for in the group discussion, if I can get a cue, like, towards the last 5 minutes, just to say 5 minutes left, and then I will try to see how I'll try to see how to wrap up if we are, running out of time.
Okay,
Something.
we can do it by the bell. I think it's less intrusive.
Yeah.
So if we can, I don't know, we're going to bring the bell.
Can you hear the bell?
That's loud and clear.
Okay. And for the audience questions as they come in, will somebody be selecting the questions for me? Because I understand that there will be a team that curates the questions and then kind of pass on the question to me, and I have to say who the person is, whoever is the person asking the question. I'm supposed to narrate the name and all this. I have a
Okay.
compliance format to follow. So I'm just wondering, how would those be sent over?
Well, the support team itself, are we doing this? Can you maybe give some clarity on your end? Are we doing the questions? Are we collating the questions with the support team?
Not really. So
Okay, no worries.
I
No
think
worries. I
the-
can, I'll try to read off the chat then.
yeah, you can
If
pick
there are
the
no
one.
questions, we have filler questions as well. So, but it would be
Okay,
great,
okay.
if we have something from the audience.
Yeah. Okay. Okay. We will play it by ear. I think if you got filler questions, I think that will be really, really good. Okay, so I am assuming
Okay.
that we are 1 minute away from being live, but as I understand it, as people join the room, they could also be listening to our discussion as we speak. So, so are you guys ready?
Yes, I
Analysts?
just have one
Hmm?
final question here. So your room setting is not a webinar setting now, yeah? I see it's like more of the open format, right?
I
Just
think
for
I
the
was
panelists, I
not
think.
sure.
It's
yeah.
still
So I think sorry,
it's
support
still
team.
the panelist system like the one that we had in the morning. So it's only the premium tickets that gets to see everyone else, whereas the attendees only see the stage.
Okay. Okay. Sure.
Okay. Okay. So we're all good. All good to go. All right. Support. Can you let us know when people comes in and we are ready to start?
Okay. I think so far this is what we have. There's no more nobody else in the attendees, so I think we can start if you like to.
Sure.
So most likely they'll start coming in after lunch. But so far we have 17 panelists lah.
Okay. Can? No problem. So, all right, I will share screen, then I will start the process going.
Okay.
Okay. Okay. So, all right, I will share screen, then I will start the process going. It seems to be an echo somewhere. Okay, ladies and gentlemen, welcome back to the afternoon session of the forum. We'll now be commencing the panel for track B, the topic being healthcare's new realities, a paradigm shift post-COVID. We'll first hear from the moderator and the panelists, And towards the end, we'll have time for Q&A. For the Q&A, please pose the question. Just let me quickly share the screen. For Q&A, please use the chat function to pose your questions, and also include your name and company so that we can actually address you properly. The moderator will select your questions for the panelists to answer live. Okay, it gives me great pleasure now to introduce some seconds while I go to track B panel. It gives me great pleasure now to introduce the moderator for this track, Ms. Jean Fu. Ms. Jean Fu is the Associate Director of FinTech Academy. She is a 2020 nominee of Singapore's President-presented Skills Future Fellowship, honoring individuals as masters of skills and mentors of talent. Ms. Jean is an author on contemporary and social monetary trends, such as Intel's National AI Workforce Readiness and Millionaire Asia magazine's Green Tech Dynamics in ASEAN. She's also a lecturer with the Singapore Institute of Management, developing programs focused on dealing with changes in an IoT economy and transformation to an increasingly connected marketplace. Please join me to welcome our moderator, Ms. Jean Fu. Ms. Fu, over to you.
Hi, thank you very much, Vincent, and a very warm welcome to the ASEAN Responsible and Inclusive Business Forum. This is Track B, where we will be discussing about new trends in healthcare. So it's my pleasure now to introduce to you the panelists for today. First up, we will have Ms. Adrienne Mendenhall, who is the Director of Business Development of Access Health International Singapore. We are also very privileged to have Mr. Jim Lim, the Healthcare Sector Lead of NCS Group, Mr. Joe Chua, who is the Group Head and Founder of Pod Technology, as well as Mr. Mark Leong, who is the EXCO member of Singapore FinTech Association and the Executive Vice President of SME Banking at Maybank Singapore Limited. I just want to kind of briefly introduce to everybody the rundown for today's program. What we're going to have is to have each panelist discuss a 6 to 7 presentation on their takes about what's coming up in the healthcare industry. Following that, we will be able to go into a group discussion with all our panelists answering some of the most important questions happening in healthcare. Later, we will have an open floor where the questions will be posed by our audience through the Q&A, and that has been explained by Vincent, mentioning that you can actually ask your questions through the group chat. So following that, we will take a cute virtual photo of everybody, and there'll be a special segment for the Healthcare FinTech Alliance Prize Ceremony. So without further ado, may I please first welcome our first speaker for today, Ms. Adrienne Mendenhall, to do her presentation on what she thinks are the key takeaways of healthcare moving post-COVID. Adrienne, please.
Thank you, Jean. So it's really an honor to speak today, and especially to see such a multidisciplinary panel. I think it'll be a very engaging conversation later. And at Access Health, we're both very excited and see the opportunities for a new paradigm within healthcare, which I actually think that I hesitate to call it so much a paradigm shift as rather an acceleration of a shift that the healthcare industry has been calling for quite some time. So there's a lot of attention on the move towards telehealth and telemedicine, but we see a larger opportunity across the healthcare system with COVID. So at Access Health, we run a network called the Health Futures Network. And the Health Futures Network, we work with corporations and startups and other entities to look at the future models of care, which we believe will be patient-centered and community-based care. So we've been putting forth this vision of healthcare of the future for a few years, But it really is, under COVID, we're seeing this happen at the local healthcare systems. So in lower and middle income countries, we're seeing a renewed focus on primary care, on investing in primary care in a way that is safe for people under COVID, but also is meeting their needs for more distributed care where they live, in the communities where they work and live. So what I mean by this is essentially a lot of the healthcare systems in the region are really focused on tertiary care. And we see this opportunity for renewed focus on primary care, which again was a call pre-COVID as well with the Astana Declaration. A number of healthcare systems around the world have been renewing their focus on primary care. And we've seen in COVID that the healthcare systems who have best responded to the pandemic have been ones with a strong primary care system. And one thing that we really see is a large opportunity under COVID is with this renewed focus on primary care is to look at how technology can really support and strengthen primary care systems. So whether that is telemedicine or it is new payments models, a new way to bring insurance companies in, and really have more of an ecosystem-based approach to care that doesn't just look at episodic care, but looks at what are the needs for patients, for their families, for their communities, and address that really in a multi-sectoral way. Which brings me to another point that with this multidisciplinary approach to healthcare, one thing that we've seen that has been quite remarkable is a number of industries who were maybe interested in healthcare but not working in healthcare have all of a sudden realized the importance of healthcare in the last 6 to 8 months. So everyone has that opportunity that they've identified in what their role can be in strengthening healthcare systems. And so we see an opportunity with this new multidisciplinary approach to care and paying for care is also an opportunity to redefine what value-based care means. I think prior to COVID, a lot of times when we talked about value-based care, we were talking about of course, how can you have high quality care at a low cost or at a fair cost? And a lot of, at least I would say in this region, a lot of the conversation was still very much on tertiary care. What's the cost of that hip replacement? Or how do you reduce the cost for hospital care? But really looking at, again, from the primary care approach of looking at when we talk about value is what is value for patients? How do we strengthen frontline healthcare workers? So even within the telemedicine conversation, a lot of it right now under COVID is focused on how do you have that teleconsult with a doctor? At Access Health, we also see really the opportunity in how do you strengthen the work that community health workers are doing under COVID. That has been a big area right now as well, or for nurses, midwives, other frontline health workers, is how do we use technology to strengthen their work and really deliver that value for patients. So I know I've touched on a few different things in a short period of time, but seeing the takeaways as really looking at how do we strengthen primary care in a multidisciplinary fashion and redefine value for patients and communities. I'll hand it back over to you.
Thank you so much, Adrian, for the very insightful sharing. So just for everybody's knowledge, Adrian has a background in community health promotion, focusing on reproductive adolescents health and prevention and the management of non-communications chronic diseases. And she was also previously working in the education administration for the National University of Singapore, the Saw Swee Hock School of Public Health, and she currently focuses on business development and partnerships in the Southeast Asia region to create new healthcare and aged care models. So we will be discussing a little bit about new value proposition as we enter our group discussion later. So right now, over to Mr. Jim Lim, the healthcare sector lead of NCS Group. Mr. Jim Lim has a role in expanding NCS influence into private healthcare and regional healthcare providers with a focus in digital healthcare ecosystem building. He was previously the CEO of Good Doctor Technology, which was a joint venture between Ping An, Good Doctor, and Grab, and set up the company in Singapore and Indonesia. He's also an industry mentor for ICT with Young NTUC, a senior fellow appointed by the Singapore University of Social Sciences, and an executive education fellow appointed by National University of Singapore. Let us please welcome Mr. Jim Lim to do his presentation. Jim?
Hey, thanks, Jin. You can hear me well? Yeah. Good. Okay, thanks. Yeah, that was a very long introduction. So I'm just who I am, trying to contribute a little bit of technology to help in the advancing healthcare because you can see my slides, right? So if you look at it very quickly, in China, it's one of the most digital country in the world, right? We know that everyone is trying to be like digital China, right? And the last two industry that's going to be disrupted or transformed in China is actually healthcare and education, right? That shows how difficult it is to transform or digitally transform the healthcare and education sector, right? So just very quickly, I have a couple of slides. You can see Thanos and Iron Man fighting. That's what COVID is all about, right? So what COVID has brought us, right? Apart from the Avengers fight, right? We are very familiar with masks, yeah? And we're very familiar with Safe Entry and Trace Together, which recently won a prize, right? Won an award, international award. And the Safe Entry, right? Even the elderly who may not be tech savvy enough needs to be able to do that, right? Although there may be alternate options of scanning your NRIC, but I can see that there are many elders who actually have to learn how to use a Safe Entry just to enter a particular place, right? So I think technology has become a little bit of commonplace. In China, we call it common technology, 科普. That means you kind of make technology available to everyone, yeah? So that is a trend that we have seen and what COVID has brought us. Now, of course, what is even more common is what Andre has mentioned, is about digital health or telehealth, right? So this is a sample of Dr. Anywhere, one of the largest in Singapore and in ASEAN, right? So it becomes so common that some of us do not really go to the clinic, especially during the phase 1 of the circuit breaker. You can't really visit, and the telehealth or the teleconsult actually really pick up a lot of momentum. Later on, we'll see that what it actually has become much bigger from what it was, yeah? Now, of course, apart from digital health or telehealth, right, COVID actually have many technologies being accelerated, right? Of course, today, if you go to any buildings outside of your home, you'll probably see these very commonly, right? Temperature self-check kiosks, right? It comes in different shape and different form. I'm just showing the one that is from NCS. So if you need one, feel free to contact us, and we have this available for you, yeah? And of course, apart from thermal self-check kiosks, which actually you see in hospitals, in shopping malls, everywhere else, right? There are more advancement in terms of the thermal tracking. So we can see a more advanced version of a thermal camera, right? And also these thermal cameras or these trackings are also used in crowd control systems, right? That you can see under the H3 below. And of course, other than these more common consumer-based technology that you see when you go out of your home, there are others such as stickman, right? Gesture detection, right? It's also very common, right? And also things like the vital sign monitoring that you probably do not know what it was until COVID time. Everyone say that you need to measure your vital signs, right? Your blood pressure, your SpO2, because these are indications of whether a person is potential a COVID, having a COVID symptom or not, right? Because apart from body temperature, there are other vital signs. And this is used quite extensively when I was volunteering in a Changi Expo for the community care facilities, yeah? And of course, other ways such as pandemic prediction, right? You probably heard of some university and polys in Singapore, including NCS also. We actually have some pandemic prediction software or applications or algorithms being developed just to see where is the most likely place that the next pandemic will hit, yeah? So all these technologies has been accelerated due to pandemic, yeah? And it will be more, right? The next one is a video that you can see. In China, right, autonomous vehicle were used, right, in fighting COVID. Okay, so very quickly, this is one of the company that NCS is working very closely now to try to do a mobile clinic trial in Singapore. So hopefully we can be as advanced as in China, where these things can move around within the hospital campus, whether is it for delivery of medical PPE supplies, or is it for other purposes, yeah? So this is something, really advancement of technologies can help in fighting COVID and bringing us to the future state of the healthcare. Okay, very quickly, another thing that we've seen with this pandemic is that health tech and medtech companies becomes part of new normal, right? Coming from a startup background in Good Doctor, there are so many companies or so many startups actually approach me to say they want to form another telehealth company, right? Today there's someone from India, tomorrow there's someone from Cambodia. Everyone feels that this is the trend to go, yeah? And from the reports from Gallant Health and EDB, we saw that actually there are more than 170 health tech companies being formed, and then many of them are definitely in the wellness area because it may be a little bit difficult to go into the clinical side of things, but wellness, health management is definitely one of key trends in the health tech and med tech. Now, of course, this is what I'm very familiar with, right? So Ping An Good Doctor in China has this 1-minute clinic, which on the right-hand side is something like a photo booth for those who are familiar in Singapore, where you talk to an AI machine, right, in terms of AI teleconsult. And on the right-hand side, you can take the prescription that is generated, scan the QR code, and purchase your medicine. Of course, this differs by country, right? Some countries allow OTC, some countries allow prescribed medicine, yeah? So this is definitely quite common in China and being deployed also in Japan, right? And of course, what we have launched in Indonesia was an app with Grab called Grab Health, right? So it's something like what you have in Grab Food, Grab Car. This is basically Grab Health in Indonesia. Okay, it's another telehealth platform, which is slightly different from other telehealth in Singapore, is that this is a purely text-based and subsequently empowered by AI technology. Okay. Now, of course, we can see in Singapore, there's also Jagami, who focus a lot on the elder care and seamless care that Adriana has mentioned, right? That you have from primary care all the way to home-based care. Okay, very quickly on I can hear the sound ringing. So very quickly on the digital health, as they have mentioned also, is the trend, right? Whether is it from a telemedicine perspective, patient monitoring for seamless care, from primary care to home care, or healthcare assistive robots. These are the market sizing that you can see, and the CAGR that is in most of them in double-digit growth, right? So this will be the trend and the market sizing that we're seeing moving forward. Right, very quickly again, based on SDG, right, United Nations SDG, and different reasons of providing affordable and quality healthcare, right? There are key trends that's going to pick up, right, from telemedicine to remote consultation, remote monitoring, remote surgery, and so on and so forth. We can discuss more later on, yeah? My second last slide, right, AI, which I was involved deeply in, will be one of the key things, key applications of influencing and digitally transforming the healthcare itself, right? So these are again some of the newspaper ratings on how AI is used in fighting COVID-19. Yeah. Last slide, right? There will be many technologies other than AI that's going to disrupt the future of healthcare, and I call them the ABCDEFG of healthcare. Which again, I teach a course in NUS for that, right? So you can guess A is AI plus IoT, blockchain, cloud, data, ecosystems, and all your e-records, and 5G. Yeah. So with that, I think I thank you. I think I overrun. We can discuss more in the panelists. Thanks. Over to Eugene.
Thank you so much, Jim. That was really a very broad and diverse outlook into what you feel is happening, actually already is happening in the healthcare space. We will definitely discuss later in the group discussion about contactless experience beyond just a mobile first culture. So please stay tuned for the panel discussion later. All right, so up next, we have our next speaker, Mr. Joe Chua, who is the group head and founder of Pod Technology. He's going to be introducing to us on his views of what's happening in healthcare. Now, Joe pioneered and launched many successful award-winning innovative projects for numerous Fortune 500 brands in key cities across Asia Pacific. And he co-founded 2 new startups, Unigons and Pod Technology, in 2017 that focused on creating innovative solutions for large international companies to solve today's barriers and inconveniences. And he also launched the first unmanned self-diagnostic kiosk Port Vital in Vietnam in August 2019 to improve better patient outcomes at a local hospital. So over to you, Joe. Please tell us what you'd like to share today.
All right, thank you, Jane. It's my pleasure that you invited me to be on this panel so I can share a little bit more what I do. I'm a Singaporean, but I'm based in Greater China for many years. And in my years of traveling, I do see a lot of very imbalance of healthcare resources. And I just now, what Adrian said is, she's saying that a lot of people who are from the non-healthcare sectors are coming on board into this digital healthcare. And it's true because I'm not a healthcare person. I spent 15 years of my life in Ogilvy advertising. I'm an advertising guy. But what brings me into healthcare is also because when we started to embrace technology for retail, for marketing, that gives us the opportunity to use the same technology for health tech. So I'm going to share with you some of the slides and some of the work that we have been doing in Vietnam. And perhaps that could inspire the audience and see how we can even move forward and contribute in healthcare. Let me share my screen. Now, I know today's topic is about post-COVID, right? But what really got me into healthcare was a simple dialogue between a guy in Pfizer about 3 years ago coming to me and say, hey, look, we love your digital tech. We love your AI vision in terms of facial recognition and also product recognition. But how can you use this, right, to actually relieve the shortage of doctors across the region? So as we know, right, most of the countries are facing shortage of doctors and nurses. These are public news that everybody knows. Aging population, people are actually living much longer. But I think the very stunning fact is, if you look into the world population and in terms of the numbers per thousands of people, we're talking about less than 1 doctor for every 1,000 people, especially in Asia, Indonesia, India, and Africa. Now, if you go to other countries, people actually have to queue up 7 hours or sometimes even longer just to see a doctor. So you can imagine today, every doctor, they have to work 14 hours and every patient contact is about 3 to 4 minutes. Why so? Because they have a long queue to service. And within such a short period of time, sometimes there could be misstep in terms of diagnosis. Sometimes there could be also, a problem whereby they're not spending time to talk to the patient. So we asked ourselves, even before COVID, a lot of populations find it's very difficult to travel to get access to healthcare because of long distance. I think people in Singapore or in Hong Kong, they are much more fortunate because we're GP, but GP concept doesn't exist in many countries. Not only when you reach there, it's the long hours. And what about if I'm there just for stomachache and there's going to be cross contamination with other viruses, especially now in COVID. If I have a fever or the flu, I may not want to go to the hospital, worry about cross-contamination. And talk about hospital. Hospital usually, the worst time to go to the hospital is actually during Christmas, Chinese New Year, and all the public holidays, whereby all GP are closed. And that's where hospital has to deal with a lot of cases. Of course, priority has to be given to the chronic patient. But what about people who just want to seek help? So this is all stretching all the public healthcare resources. And we ask ourselves, how can we come in to help? And of course, like what all the other 2 speakers have said, it accelerates everything. Travel restriction, because we have a lot of foreign doctors and nurses who are from overseas. They're unable to come to Singapore because of COVID restriction. So where do we get all our healthcare resources? Bottleneck in hospital. And also right now we have a segment because if you are a COVID case versus the non-chronic cases and chronic cases. So with all this segmentation of resources, we actually stretch the resources even much thinner. So we launched the first self-diagnostic kiosk in Vietnam together with Pfizer. We installed in a private hospital. And this is the picture. I won't share the video here, but I will share the link later in the chat group. So for anyone who is interested to view the video, so you can click on the link later. But more important is to show you the effectiveness about how can we actually relieve all the workload that's faced by today's nurses and doctors. Now, these are all the time taken average for a healthcare worker to engage with a patient. Now, it's a very long process from the moment you walk in, you register, they diagnose you, they check your symptom, ask you why you are here, and then dispensing, doing cashier. So you can imagine with the shortage of all the resources, healthcare worker has to also participate, right, in administrative tasks. How can we actually free up them? So in average, right, it's about 20 minutes of precious resources that's being used on the patient. Now, if digital healthcare can come in to help, not 100%, but at least 80% of these tasks, we could actually save quite a lot of the time from the current nurses and doctors. And this is why we come into place a simple self-diagnostic kiosk that's allowing registration, self-diagnostic, simple input, payment checkup, and also medication dispensary. So this is all the places that we have installed in Southeast Asia. And we actually did all the calculation of the number of patients that is served. It's actually quite saving a lot of manpower, free a lot of manpower from the current need. So our ultimate aim is to embrace all the AI technology, blockchain, 5G, and all into trying to bring this technology beyond the traditional channel, so we can free up more resources at the hospital and put it at populated places outside channel. And not only we have to do it ourselves, we have to work with insurance company, work with pharmaceutical company to bring this vision to life. And it's adaptable because it's able to adapt into very small format, and it's very easy to install so that it actually lowers the cost for installation and setup. These are dispensary concepts. So when you see a doctor, you can actually get your pharmacy dispensary 24/7. Last but not least, this is actually what we always believe is trying to deliver the 5 A's of digital healthcare. Jean has A, B, C, D, E. I focus on the 5 A's: availability, accessibility, affordability, adaptability, and authenticity. How can we use digital to really deliver the 5 A's? And this is the entire ecosystem that what we have been doing during COVID's time, not only just doing self-diagnostic, but also investing a lot in preventive healthcare. The last slide, what happened last week in Vietnam, we actually are preparing for the reopening of schools, not only for Vietnam, but also for Singapore. We're trying to equip the teachers, staff, and students to combat the potential spread of COVID-19 in campus. So we deliver a dispensing machine that can mix surface disinfectant, and teachers and students, they are able to redeem the liquid right through the machine. So you don't need to transport thousands and thousands of plastic bottles. The machine is capable to mix the mixture and then dispense them via a supply of tap water. Yeah, so that's about all my sharing for today. Thank you.
Thank you very much, Joe, for sharing, the insights of your innovations and the technology. We definitely will be talking a lot about the impact of digitization within the healthcare ecosystem and how the ecosystem is actually being changed because of digital transformation. So before we go to the group panel discussion, we have our final speaker for today. He is Mr. Mark Leong. He is the Executive Vice President and Head of SME Banking at Maybank Singapore, and he's mainly responsible for matters relating to consumer mortgages and purposeful loans, including marketing, acquisition, portfolio growth, profitability, and retention. So we're very happy to hear from him, coming from a banking and financial standpoint regarding the roles of how the financial sector actually also contributes towards the healthcare ecosystem. Over to you, Mark.
Thanks, Jane. Hi, good afternoon, ladies and gentlemen, friends. Well, it's always, I guess it's a privilege always to be the kind of sore thumbs taking out, because I'm the only non-health guy, health tech, health management guy here, but I'm happy to be in the midst of healthcare management experts here. We've got technology and thought leaders here and professionals in this field. It's a privilege always. And well, I certainly at Maybank we don't have the 5 A's as per Joe, and I certainly don't have Jim's A B C D E F G, right? I think Jim, right? So I was paying attention. I was taking down notes, So these papers are not for knots. But in banking, we always have the ABCs of credit: A scores, B scores, and the 5 C's of credit. But let's throw it out the window. All right, let's talk about healthcare. Sometime late last year and the beginning of this year, Maybank itself in Singapore embarked on a strategy what we call Life 2.0. Life 2.0 essentially it's is our strategy and plans to kind of tackle and take care of customers beyond after their working life, right? I was going to say beyond retirement. Almost got it wrong. Beyond retirement means death, right? No, before death. After retirement, we have got, no, after work life, and when you retire, you have got a solid 20, 30, 40, 50 years up ahead, right? So it's very crucial. And within this whole scheme of Life 2.0, we, over the areas that cover SME banking, we kind of cover areas that cover 6 areas that I've actually zoom in on the SME portion of things. But before that, sorry, let me just backtrack a little bit. Life 2.0 covers everything from retirement planning, lifestyle, your healthcare, as well as your medical care, right? Post work life. And so at the SME segment level, I've actually earmarked 6 areas that I think we can focus on. And I'm so happy because all the 3 other panels, we can really work together going forward. But let me just detail some of the areas that we are looking at. 6 possible players. First area got to be the medical professionals and the trade associations. I think this is a very important stakeholder that we have to work with and to grow and expand this business of healthcare. Next one are the healthcare aggregators. I feel that within the panelists here, there are already whether the health tech people, whether the aggregators like Access, you guys are already there. And I think it is a very important, vital part of the ecosystem. We definitely have the brokers and insurance players up next, number 3. The real estate and property is equally important because these are the guys who, knowing that, yes, Joe and Jim talked about mobile services and ports and everything, but still, I think the real estate part of the business cannot be ignored for the healthcare business. Of course, the 5th one being medical and equipment suppliers. This is a crucial part when we are lacking masks, lacking in PPEs and everything. We certainly need that portion of the business, and we're happy to. The bank is happy to kind of look at this areas of business. And lastly, because I have run out of ideas, that's why I call it the friends of supply chain. It means everybody else that is not in the 5 categories, friends. So Jim, Adrian, Joe, I don't know, you're either the healthcare aggregators for me or friends of supply chain, okay? So it doesn't matter, right? So some stats from the Maybank SME segment. We currently, the bank in Singapore, serve over 1,000 healthcare related businesses. It's not a lot, but we have 1,000 over plus customers and over 3,000 retail individuals who are actually healthcare related work, right? Could be doctors, nurses, guys in this sector. Now, this is a small number, like I mentioned earlier on. That's why we need to continue to stress our focus in this very, very strategic and important sector. In just the past 10 months, in the most busy period of the COVID and the most technically stressful period, my SME team, we have served about 100 companies related to healthcare, clinics, suppliers, therapists, specialists, etc., and dispersed over $40 million worth of working capital and property loans in just this last 10 months. So needless to say, with the healthcare guys, it's definitely a preferential pricing. And the credit part also, we have actually done away with a lot of the tough questions. And because we know it's crucial and we know it is a challenging period and want to help as much as possible. So happy to report this financial year, we should end on the healthcare sector-wise, a very strong double-digit growth in all areas of healthcare, loans, deposits, and even our revenue numbers. And I'm in a kind of I guess a slight privileged position. I'm a bank officer, a banker by training. I also am an EXCO member of the Singapore FinTech Association, right, office, and it's a privilege for me to blend in both healthcare and health tech. To an area which I'm now learning and growing and loving every day to kind of grow and focus on it. So I mentioned earlier on, I need to give thanks and also say that I'm inspired by my fellow panelist, Joe, and his his Port Vitals in the Vietnam hospitals, doing great job, Joe. I hope to touch base with you even after this to see what we can do. With Jim and his role in NCS Healthcare Digital Footprint and his ABCDEFs, I'm learning a lot, Jim. So let's see what we can do together. And with Adrian, I think that Adrian and Joe, we have Maybank Foundation, which has a lot of work in the other parts of the ASEAN countries like Vietnam and Cambodia, right? We also have the Maybank Eco Weavers, which I explained in my earlier speech in the lunchtime. So we certainly have our stake in those areas. Maybe areas that are underprivileged, we are supporting in terms of income and helping them grow the sustainable income portion. But we certainly want healthcare to be a big part of this whole thing, because it is, after all, not just life, but not just livelihood, but life as itself, right? So I look forward to touching base with all 3 to see how we can advance the Vietnam, Cambodia, and the Maybank Foundation ideas after this session. So I believe at Maybank, when we offer things like, as a bank, as a financial institution, we offer credit and risk management expertise, certainly not healthcare. We offer funding opportunities, we offer cash management solutions, and of course, linkage to a huge customer base, retail and non-retail, not just in Singapore, but across ASEAN countries. Maybank is privileged to be the only bank the only regional bank that has access to all 10 ASEAN countries with branches and offices. And that puts us in a good stead to kind of focus on healthcare, and of course the larger umbrella of Life 2.0 initiatives set going forward, whether it's Singapore or the region. And with that, I essentially look forward to having a very fruitful and productive healthcare and health tech year ahead, 2021, and let's see how we can collaborate and bring this forward together. Thank you.
Thank you, Mark. That was a very good wrap up to the panel individuals' presentation, especially ending off with beyond healthcare, which is health tech. A lot of things that we talk about today. Now, also coming from FinTech Academy, we understand the value of how digital finance is to the healthcare ecosystem. We are going to move now forward into the group discussion with all 4 panelists. And we do have very interesting questions because our panelists come from such diverse but very integrated background within the healthcare ecosystem. So I'm going to build upon what Mark has already mentioned about connectivity in the sense of all stakeholders within the healthcare ecosystem. So my first question to the panel is, how do companies tackle the challenge of balancing subsidy schemes, insurances, and out-of-pocket expenses? Because in our audience today, we have a lot of founders and leaders from the business sector who run companies. We also have representatives from clinics and hospitals. We're keen to hear how can the balance of subsidies and co-payment and insurances actually come into play and be narrowed in terms of healthcare financing in general. This is open to any panelists who would like to take this question.
Maybe I'll start first then. Yeah.
Go ahead, Jim.
Yeah, sure. So I think it depends on country. So in Singapore, we may be a little bit more privileged because we have a very good government support scheme, right? Whether is it a MediSave or Medicare or all those things. And then for those of us who are working for corporations, we probably will also have corporate insurance coverage. Yeah. And I think in Singapore, personal insurance, especially healthcare insurance, is probably one of the highest in Southeast Asia. Yeah. So I think we are kind of quite privileged as compared to many of the neighboring countries where the affordability for healthcare insurance is potentially still challenging. Yeah. But having the privilege also brings about other sets of problems, right? So I can always remember myself going for my every 5 years colonoscopy, right? Which insurance do I use first? Do I use my personal insurance? Do I use my company insurance? Or do I use my government insurance first, right? There's no simple answer. You need to get someone to advise you. And filling out the forms and getting reimbursement is very challenging as well, right? So if you look at it that way, actually, how do you make things simpler for the patients, right? People like us, right? And I understand that actually, if you do some Google search, there are many companies, some of them outside Singapore and many in China, trying to build some kind of concept called a healthcare information exchange, yeah, HIE. So you can Google HIE, you can see many things about that. And these are usually not driven by the healthcare providers, not the hospitals, right? And they are usually driven by the financial institution, right? Whether the insurance company or maybe the banks, yeah? And in Singapore, I can't tell you, but someone is working with us on that as well, but I can't tell you who. So I think the entire concept of HIE is very important because it kind of helps to streamline the information. So imagine today as a patient, right? You need to get forms, get data, get your hospital reports, go to your insurers, bring the certified true copies, bring it to them. They have to validate, right? You need to fill out forms to submit your claims, right? It's very complex, and the exchange of information and the process kind of cumbersome as well. So in the HIE concept of platform or framework, no matter what we call it, it is going to be enabled by technology, right? I wouldn't say it's driven by technology, I'll say enabled by technology, including things like AI, which can do analysis of your profile as a patient, your insurance, different types of insurance coverage, so that it can best advise you, do you have enough to cover by your personal insurance or corporate insurance, or it's better to use your government insurance first. So the AI with the data will really help a lot. And of course, in the exchange of information between the insurance provider, yourself, hospitals, bank as the clearinghouse, and many others in the entire ecosystem of this claims process. Some of them even involve third-party administrator, TPA, right, for some hospitals. So in this exchange of information across different stakeholders in the ecosystem or in the claim process, you need secure information exchange. And again, like my ABCDEFG, you heard about how AI can help. The B, the blockchain comes into picture, right? It really helps in the secure information exchange for these kind of things. Yep. So if you ask me, technology is definitely playing a part, right, to help in streamlining the entire claim process or insurance coverage, right, framework, so that it becomes more affordable, because whatever savings you get with technology trying to enable and streamline the process can potentially pass down to the patient itself, right? Because you may have less human involved or labor intensive involvement in the TPA or claim processing. Then with that, you can channel some of the savings, right? The insurance company can potentially sell you insurance that is more affordable to you, right, to use. And the entire claim experience is actually much better as well as a patient, and also for the hospital, right? They don't need to have maybe dedicated people sitting there getting you paying $100 in a public hospital to just buy a medical report. I remember I spent like 10 minutes waiting there just to buy my medical reports. So all this waiting time, all this processing time, all this human labor intensive thing can be potentially streamlined, right, in a more secure and more effective manner. Yeah.
Okay.
And if I could just build off, adding to what Jim said, and absolutely, the role of technology, I think a good analogy is taxes. As an American living in Singapore, I can say that I absolutely despise filing my taxes in the US, and I absolutely enjoy the process in Singapore, because without hyperbole, it takes me 3 minutes to file my taxes in Singapore because of the use of technology. And if we can have that same experience for insurance, no one, I think, claims to love their experience of claims for insurance and looking for reimbursement. So if we can bring that same customer-centric approach to insurance, but then I think, when we talk about health information exchange, there's also a role as well to make it easier to create these exchanges. So our team in India has advised the national government on the National Digital Health Blueprint. And a main part of that is including standards and having interoperability for the data, so that when it comes to making claims, we can even have data that talks to each other, because we do have those standards in place, and make it a lot more efficient. And I think that's where there's a role for governments across the region, is in order to set those baseline standards, so then we can then enable these types of health information exchanges, and then be able to bring in a stronger role for technology, so that it can really become a holistic approach, rather than kind of a piecemeal way to do this, as far as particular hospitals, specific insurance companies, et cetera. And the other thing that I wanted to add as well is that there's also, I think, a big opportunity when we're looking at the out-of-pocket payments that remain as well, is to look at how banks can come in as that financial partner for patients. So even with insurance, we're still, as long as reimbursement is a component, especially reimbursement of significant funds, when we're talking about thousands of dollars, it means that someone has to have the cash on hand in the first place. Out-of-pocket payment is still part of the equation. Even if it's going to be covered 80, 90% of the total cost, you still need to have that cash on hand. So what becomes a trusted, transparent way for patients to be able to easily access that credit that may, for claims that will later be reimbursed? Or what I think in Singapore, we're also very fortunate to have MediSave accounts. What is the role of technology and banking to be able to create similar incentives for incentivization structures for people to save for anticipated healthcare costs as well. So really looking at what is that bundled health financial suite of products so that health financing can become as patient-centered as the care that's provided.
Thank you so much, Adrian and Jim, for sharing your insights. Now, this leads me to the next question, tying in the value of technology and the patient experience, because so far we have been very focused on the supply side of the business side of it. I'm curious to know, with all the hardware you guys are putting out, with the software that's coming up, what are some key considerations or challenges in technological designs to ensure that digital healthcare feels less transactional? How can you preserve the integrity of the, in-person warmth and the care when delivering all these diagnoses, or even trying to ensure that the patient feels all these services are affordable and seamless for them? Would anybody like to share some insights?
I can share a bit of insight. I think the entire journey, when we talk about the human warmth, right, and the sense of assurance, I think we all know about the design of empathy, customer experience, how you use empathy in all your design. But that also have to be considered. I think the introduction of digital healthcare should be always be included at a much earlier stage. Now imagine when you are sick, when you are feeling miserable, the anxiety that you have at that moment, right? Because instinctively you have to go and get instant help. You need to get a doctor. You need to see a doctor. You need to get a remedy. So for that, this is where I think digital, when we design those features, avoid using non-human contact, even though you're using a piece of technology. But it's always good to have a virtual, a real human talking to you, because in China there are a lot of chatbots. Right, chatbot is good when you're talking to financial banking or anything. But I think most of us who use financial banking, we will still prefer to talk to the operator, rather than we press all the buttons and get all the answers back. So this is one aspect. Another aspect is about the follow-up. A lot of technology feels very transactional, because after I get my remedy, that's about it. There's no follow-up. So technology can help to know how you've been feeling. So let's say if somebody deliver your medicines to you, then it feels good that maybe 2 days later there's a follow-up call or follow-up message to see how you are feeling, and if there's a need for the system to refer you to somebody else. And also maybe in 3 or 5 days time, when you get well, because of your precondition and because you have a medical history, a system could actually come and recommend you what are the things that you should keep up. Maybe your diet, maybe the time you sleep, or other factors. So all these bits and pieces touch point will add a lot of constant reminder that there's always someone like a coach or somebody who's always looking after you.
Thank you for the insight, Joe. Would any more panelists like to share some insights? Okay.
Maybe again, let me just share one addition on that. So I think there's no way that we can replace a physical doctor with technology, whether it's AI or robots, right? Don't try to do that. I mean, there are people who try to put so-called humanoid robots, right? You design pretty lady doctors so that you feel good talking to them. Don't try to do that, because the more you try, harder it can be more difficult, right? There's no way, make it very clear, there's no way that you can remove or mimic the human touch, right? No matter how good is the technology. So that has to come in place. But what I think technology really helps is what Joe has mentioned, right? You look at the ecosystem itself, you look at what are the gaps, you look at what it can be filled. And one of the gaps that we have discovered or realized when we do some of this technology design thinking is that, for example, whether the kiosk that Joe has or the 1-minute clinic is very useful in the A&E situation. Yeah, you put in the A&E department today. What happened in A&E? You go in and then you see maybe the nurses or the younger doctors, right, are actually attending to you, because it's so everything is so moving so fast that you don't really have time for that. Yeah, so some of this may really speed up and release some of the pressure and time. Secondly is that we realize in another thinking is that the people, the patients, relative or family members who are sitting waiting outside, right, they are very anxious, but no one really have the time to talk to them. So when you design whether an apps or any technology, look at what are the gaps to fill. The patients, families waiting anxiously outside and trying to grab hold of any doctor or nurses to ask about the conditions are potentially the one who can benefit from technology, right? Whether is it an apps or is it something IoT in terms of video analytics, looking at the operation, this kind of thing really help to relieve the stress on the patient families, as well as relieve the pressure and the workload of the attending nurses or physicians. Yeah.
Okay, thank you so much, Jim. So perhaps we will have one final questions before we open it to the floor. So building on what we have discussed, we've talked a lot about the so-called digital experience, the remote experience, and I'm curious to find out, how can contactless experience in the healthcare ecosystem really become a growth strategy for businesses or anybody in the infrastructure? Because we have talked about in your presentations, besides the very commonly known phone apps, mobile first kind of platforms, from Jim's and Joe's presentation, we learned about autonomous delivery. We learned about even robotics. So when it comes to the follow-up, as Joe has mentioned, how can this contactless experience go beyond just with a screen? In that sense, are you able to shed some light, in that? And definitely, Mark or Adrian, if you would like to chime in as well, because if it becomes a growth strategy commercially, it's something that that's where digital finance will have to come in play, and a new kind of system would have to kind of be brought into as well. So
I just want to maybe add a little bit. Yeah, just now when Jim was talking and Joe was talking, I was just in my mind, I was just thinking about Baymax, that character from the Big Hero 6, where this. So yeah, that's not a sexy girl, but it's certainly a very fun, huggable, inflatable nurse sort of play. But that aside, now we have been from the SME or banking perspective, right? When government launched that whole SME Go Digital movement, noticed that there were actually 5 modules that were being launched last year, right? SME Start Digital, and the 5 basic modules was accounting and finance, was marketing, transaction banking, cybersecurity, and HR. And in the HR aspects, right, what some of the solutions that the fintechs and the vendors provide for our customers through the banks was that this contactless part, right, whereby you no longer have to kind of physically fill up leave forms to apply for leave. You no longer have to report for duty using the punch card or even a tap-in card, right? So everything is contactless. And when the workers go onto the field there to kind of on the construction field, it's all taken by a GPS to determine that you are actually there physically, right? No more just photo you can kind of Photoshop behind. So these are ways that the technology or the fintech space has kind of pushed the whole HR piece forward. But so when I was looking at this thing, one of the ideas we had was healthcare, right? How can we not just use? I mean, we have talked about telemedicine, so we have a couple of partners that Maybank has tied with, and Dr. Anywhere is certainly one of the pioneers of this movement, and we have that partnership as well. But we want to move that further, right? With Dr. Anywhere, even with other healthcare providers, not just on the contactless bit, which Jean is talking to, but was talking about, but also on the statistics, right? Kind of like if you could work on softwares, report statistics that could kind of determine not just when you see doctors, but how many of the population of that company is seeing doctors at any point in time? What's the percentage of them falling sick at any point in time? Is there a particular department that is that has constant people calling in sick? And how long is the average sick leave, and what's the common illness, and all these things I think is very important, right? Not just but also the statistics will enable any company, whether it's SME or MNCs, to kind of determine the areas that we or they can improve, in terms of the employees' healthcare, right, and also work fair. So I think this is an area which Maybank is very keen to kind of work on and work with, and we are trying to find our ideal solution so that we take this out, not just the 5 modules that the SME strategy has, but also the health tech module maybe we call it module number 6 or module number 7, it doesn't matter, right? But at least put this out there and kind of push this as a very valuable tool to serve the SMEs and the communities that we have. So this is one area which I think kind of not exactly medicine, but at least information, data that will allow our businesses to be able to make better decisions. And yeah, of course, it's certainly contactless. Yeah, thanks.
I think you've brought up a really good point about information. Is a lot of times when we talk about health tech, information feels like it is something that is tacked on as a nice to have or part of marketing. But for the patient, from the patient's perspective, from our perspective, when we're using healthcare, information may be the most important part. So whether it's from the patient perspective or the planning perspective of how we can access trusted information, where that information comes from, and the value of it to patients, providers, and payers. And so I think there's also a real opportunity with COVID and with this paradigm shift to look at how we value information as well, including for the patients. And one thing that I also want to bring up of, a few people have in the telehealth conversation is, while we know that telehealth is not going to replace doctors, and there's always, I think, an assumption when we talk about telehealth that it's how to access a doctor. But I think it is really important tied with the information of who are the other healthcare professionals that patients want to ask questions of, and how can we use technology to upskill, not just upskill, but encourage patients to reach out to nurses, physiotherapists, other people within the healthcare setting who can usually answer the questions, especially if we're talking about triage. So how do we bring other healthcare professionals into that triage experience and use financing as potentially one part of that incentivization as well? I think we've all had that experience of, it's 8 o'clock at night, you can't reach a doctor. Do you really need to talk to a doctor? I just want a nurse to tell me what to do. Do I need to bring my kid in? Can I do something at home, et cetera? And looking for those opportunities as well.
Hey, thank you so much for that very dynamic discussion by the panel. Now, we're going to open this session to the floor. It's the Q&A for our audience. But we actually do have questions coming in already. So perhaps we could just start off with one. This comes in from Sunny Chin. I guess he represents the California jurisdiction for brands for goods. Now, I think his questions asks, what is your view on communication channels and the differences in languages via telemed? I guess Adrian has kind of answered that a little bit. In that sense, we can build on it. If you have views on how possibly, marketing messages should be better conveyed, or how do you actually manage the differences in languages when you're in different jurisdiction?
Yeah, maybe let me just share my experience, having done one myself, right? Okay, so I think languages is not the biggest challenge, right? Because the technology today, at least from converting from one language to another language, is more or less there, right? Whether through a very good AI deployment or some other technology, right? It's there. So it's not the biggest challenge, right? But of course, setting it up can take some time. So for example, when we brought Ping An Good Doctor from China, which is primarily in Chinese language, to Indonesia, which is primarily Bahasa Indonesia, it's very challenging, right? It was slightly easier when we want to bring it to Singapore or those English-speaking company, English-speaking country. So when we talk with AI for the one in NUS, right, the government AI initiative, right? So it takes about probably 2 to 3 months to get the entire language ready, right? Language here, we're not just saying a simple translation, because you need to map out the entire clinical path and then do some kind of labeling, right, in terms of language. So that is not that difficult. But when it comes to Bahasa, it can be slightly more challenging, right? So today there are many AI companies who actually focus just on the language pack, right, doing the translation itself. So that's not the most difficult, although some of that may take time. Right, communication channel is the interesting one. I think it depends on many factors, whether is it a country regulations, right, or is it the consumer preference and the accuracy of things. So if you look at it that way, in China, Ping An Good Doctor has two modes of communication. One is through your apps, right? Through the apps, you can consult a doctor. Same for the doctor anywhere in Singapore, same for Hello Doc in Indonesia, right? But in China, the main objective of Ping An Good Doctor there is to achieve efficiency. So instead of one doctor seeing maybe 8 patients through a video consult like in Singapore, because each one take, let's say, see about 60 patients, because assuming you work 8 hours a day and then you take 8 minutes for each consult, right? It's through a video consult. But in China, it's not a video consult. It's purely text-based and maybe voice to text, because each doctor there can see 500 patients a day, right? Within 8 hours, right? Because you have AI triage and you do multiple, it's like communicating through WhatsApp, right? You can do multiple windows. So you can't really do a video consult where you actually need to see the doctor yourself, right? So that's a different objective. Whereas in Singapore, due to regulations, it has to be a video consult. So the efficiency may not be as high as in China. Whereas in Indonesia, what we realize is, okay, first of all, it's not regulated that you need to do video consult. Secondly, is that people there prefer text, right? They don't really like to talk. They don't like you to see them as well. So it becomes a very text-based communication, right? So I think the communication channel, it can be apps-based, it can be a video consult, it can be maybe even having a kiosk that you talk to the machine, right? There are many, many ways, but it really goes back to the regulations and the consumer preference in those selected countries. Yeah.
That's a very good insight, Jim, in terms of knowing that, we would have to localize and actually understand the local context when we actually conduct, healthcare related businesses over there. Now, just building upon that question, I'm wondering, when it comes to healthcare digital readiness, something that really has been accelerated because of COVID, whether it's for the supplier or for, the patients or the insurers, what do you foresee as good governance and best practices in digitizing healthcare? This is somewhat of a broad question, but I think, I think a lot of stakeholders do actually spend more time now really crafting out the framework for actually implementing, good governance when it comes to taking the next step in going digital. So I guess in your experiences, what do you think are some of the most important aspects that we really should pay attention to?
I can start. I think the pathway to digital healthcare helps to centralize and consolidate things. Under good governance, you don't have different hospitals or different clinics, right? Fighting, right, for the same supplies of medications, right? And in many other countries, I do see a very imbalance of costs, right? If I go to this hospital, somehow the cost of seeing a doctor and the cost of medication is actually slightly higher, versus if I travel another 10 kilometers away, it may be slightly lower. So when we digitize things, I think there are two things that we can centralize and helps to bring two benefit. One benefit is a common platform, all right, whereby all the clinics and all the hospitals, right, they will share. I think right now you have safe entry platform. You have a lot of those health pass. In Hong Kong, we have health passport. But now the health passport app or the safe entry app only talks about whether you have COVID or not, right? What's stopping us for using the same application to upload our own personal docket, right? So if you move house, for instance, from the east to the west, if you see a new GP, right, you don't need to ask the other GP to transfer the information. So the access to information will be now within into your hands. But again, we need good governance to put policy into place. Because right now, if I ask my doctors in Singapore to send all the medical records from Singapore to, let's say, to Vietnam or to any place, first we have language issue. People there may not know what was being written. So the longer the time, the less information the doctor has about me, takes him longer to diagnose me and then to provide solution for me. So that's one. And when we talk about digital healthcare, we talk about central logistic. If we have an agency like, for instance, Singapore has ALPS, which is a very good agency. They centralize all the medication. They distribute out. So I think that helps to keep the cost at a very affordable rate. And this is something that I would like to see in the other region of Southeast Asia, or if not, throughout the world.
Okay. Would any more panelists like to give a insights on this. If not, what we can do is, in the interest of time, we would actually just do rounding up comments by each panelist before I hand this session over to our MC for the virtual photo. So may I invite each speaker to provide your summary statement? What's the key takeaway you would like for us to know today? Adrian, could we start from you?
I think my main takeaway and the optimism that I'm going to walk away from this panel is that we're going to continue to see multi-sectoral investment in and solutions for the healthcare market, and really looking at beyond just the services provided, but the information and financing that is available to patients as well.
Thank you so much. And Jim, would you share with us your closing statement?
Yeah, thanks, Jean. So I guess hopefully everyone remembers the ABCDEFG of healthcare after today. Yeah, and that's the technology that will be disrupting healthcare. But don't forget, like what Adrian said, it has to be patient-centric. No matter what technology you deploy, if it doesn't serve the patient needs, then it's useless. Yeah.
That's very good insight. And Joe,
I think we have all the technology that's ready today, and we also have all the specialists that's all ready. I think the biggest step is for all the healthcare sectors, industry people to really embrace all this technology. I think there's a lot of fear. Don't fear, just embrace it and see the effectiveness coming out.
okay, thank you so much. Mark, final statement from you.
Yeah, thanks, Jane. So on the note of fintech, right? Which are fintech, and we have a Singapore Fintech Festival this week, right? It's also conjunction. Now the banks have launched what we call the SG Findex, right? Singapore Financial Data Exchange. I think this is a open banking concept, one of the first in the world, connecting the open banking concept all the way with SingPass and MyInfo and everything. So it's a wonderful integration of banking system with the government's data central depository. So lots of happenings there, but most importantly is this phase one. You will get the loans, your deposits, and some of the investment portion, right, that can be shared within banks for one single bank to kind of see overview of all other banks. I think for now 7 banks that you will do the financial planning for yourself. But going forward, phase 2, you find insurance being in the database as well. So we talked a lot about healthcare today, but also the cost of healthcare going forward, whether it's co-sharing, whether it's your own planning. It's important to have the right tools, the right risk management tools, the right insurance tools to kind of help you see through it. I myself, I've got my dad and mom who did not have the proper insurance tools. I have my father-in-law and my mother-in-law who is of certain age now who did not have the proper insurance tools as well, right? Who do not have. So it's important. Take advantage of the SG Findex Open Banking Concept Forum. Whatever banks you're banking with, do your financial planning through your chosen banks. And it's important to start early, start now, and use this technology that, as we're talking about, to consolidate everything. Let your favorite banker, whether it's Maybank or whatever bank, look at it and plan it. And I think with that in mind, what the most important part of your life after you work, which is life 2.0, like I talked about earlier on, is going to be at least well handled. Okay, before we even talk about going to see doctor, we must have the kind of funding for it. I think so. Actually, Findex very important. Guys, go for it. Thank you.
Yeah, thank you so much. I mean, we've covered really a lot today, both on health affordability and accessibility of healthcare, and definitely the digitization of it and the optimization of the financing aspect. So before I hand it over to our MC for your virtual photo, I would like to invite everybody to actually stay behind after, because we have a very special segment, which is the prize presentation ceremony of the Healthcare FinTech Alliance Innovation Challenge. We will also have a speech by Mr. Shrida, who is the Pfizer India country manager, to talk with us at this segment after our virtual photo taking. So once again, a very warm thank you to all our panelists. We learned so much today, and a very warm thank you to our increasing number of audience. Right now, we shall hand it over back to our host, Vincent, to continue the rest of the session. Over to you, Vincent.
Thank you very much, Jean, and thank you very much to the panels. We have learned a lot today. So can I, now it's photo time, okay, which means you're going to put on your best smile. Can I get all the panelists and yourself, moderator as well, Jean, to look at the camera okay, and give your best award-winning smile, or give a thumbs up if you want, okay, and we will take a photo, and support will let us know when it's done.
Okay, everybody, big smiles. Ready? 1, 2, 3. The first page. Okay, the next one, next page. Hang on. Ready? 1, 2, 3. Okay, done. Thank you.
Okay, thank
Oh,
you, thank you.
You missed Michael. Michael just came in.
Well,
okay.
Michael has got to be Photoshopped in, unfortunately. So, okay, so we have come now to, thank you very much again, panelists and moderator. We'll come down to this special segment, the Healthcare FinTech Alliance HFA Prize. Ladies and gentlemen, okay, this is actually a special prize ceremony, okay, for HFA, okay, the Healthcare FinTech Alliance, has identified the massive challenges of the global healthcare system in providing affordable healthcare, especially in emerging markets and poverty-stricken nations. While technology has accelerated and advanced healthcare for those who can afford it, the less affluent becomes financially disadvantaged, reducing their ability to seek, afford, or establish or access the necessary healthcare. To counter the imbalance, HFA was established to connect like-minded individuals and organizations in the creation of a technology ecosystem that encompasses the industry, academic research, investment, entrepreneurial, and patient communities to develop working scalable solutions to improve and democratize healthcare. We'd like to share a video now, and before we get Dr. Sidha to present. Please enjoy.
As Singapore continues to build for the future, to maintain its competitive edge as the region's innovation powerhouse, it is critical for local staffs to take advantage of emerging technologies to drive transformation for the healthcare sector. The ability to harness the collective resources that HFA is providing will help them make their mark on the global stage.
We are excited to be involved in empowering innovators by bridging them to academia and industry experts in technology translation for addressing real healthcare issues in impacting beneficiaries' journeys.
Pfizer's purpose is to deliver breakthroughs that change patients' lives. As Pfizer, we understand the importance of building on collective expertise to strengthen healthcare ecosystems and communities, enabled by technology and backed by financial knowledge. The formation of this Healthcare FinTech Alliance is a clear demonstration of Pfizer's commitment in Asia emerging markets in order to leverage synergies between cloud technology, financial capabilities, and pharmaceutical expertise, so as to be patient-centric in fulfilling healthcare needs.
Okay, it gives me great pleasure now to introduce Mr. Sridhar, the Managing Director and Country Manager for Pfizer India, to share more about his work. Mr. Sridhar?
Thank you, Vincent. Good afternoon, good evening, everybody. Pleasure to talk to you today. I take the opportunity to thank our guest of honor, Ms. Siman, Senior Minister of State, Ministry of Communications and Information, and Ministry of National Development. All the distinguished speakers, panelists, and all the audience who are present here today this afternoon. I'm really humbled and honored to represent Pfizer in this event today. Pfizer, Alibaba Cloud, and FinTech Academy have come together to form Healthcare FinTech Alliance to speed transformation across Asia Pacific's health and financial technology sectors. Pfizer, with its 171 years of existence, has always stood for innovation. It's a fact at the core of our existence, our purpose of delivering breakthroughs that change patients' lives. We feel innovative, efficient, and patient-centric support system must be put in place to help improve with the level of affordability and accessibility. With its go-to-market commercial experience, Pfizer will provide thought leadership to address barriers around affordability and accessibility through its established network with healthcare professionals and key opinion leaders. Since July this year, the Healthcare FinTech Alliance, together with our partners, including Access Health International, started its inaugural HFA Innovation Challenge, aimed to attract startups and entrepreneurs to help address healthcare-related issues with a focus on solving healthcare affordability and accessibility challenges in the Asian emerging markets. Challenge number one was to maximize the reach and efficiency of patient support system via technological applications. Challenge number two was to expand access and affordability to medicines and quality healthcare via innovative financing. From a few hundred of healthcare and fintech startups and teams, the organizing team eventually filtered down to 6 finalists. They are BookDoc, Doc Equity, Credify, Reach52, Haro Health Group, and TPA Joy ID, who all pitched on 10th of November. I'm happy to share that our challenge winner is BookDoc. BookDoc is a very innovative healthcare startup who places the patient right at the center of the solution. With a current footprint in about 5 countries around Asia and based out of Malaysia. By winning the challenge, we'll offer the opportunity for the HFA partners to mentor and support the startups in scaling up the solution. For example, our alliance partner, Alibaba Cloud, will be providing $10,000 worth free cloud credits to our challenge winner, as well as access to technology experts. With great pleasure, I now would like to present BookDoc the winning check of $50,000. Congratulations, BookDoc, once again. Thank you.
Thank you very much, Mr. Streeter. I would like now to invite Ms. Jin Fu to do the next stage of the prize presentation. Jin? Jin, you're on mute.
Okay, yep. I just want to kind of show this screen here. And thank you so much, Mr. Shrita, for giving everybody a very good overview of what has happened throughout the HFA Innovation Challenge. We did reach out to many countries, and we had over 100 pitches submitted regarding, promoting healthcare in the best possible way. So may I please now invite, you to present that check to our winner, BookDoc. BookDoc is actually here. And also, we also invite Dr. Lillian Cole, the founder of FinTech Academy, to be with us. So can we just take a quick look here? BookDoc, are you here? Can
yes,
you wave or say hello?
Hi.
Yes. All right.
So without further ado, allow FinTech Academy to present to you the cert and the check from Pfizer. All right. So yes, here you are, our champion team. Put Dot. Give him a drum roll. Drum roll, drum roll.
Bookdog, please accept the check, the virtual check that has been sent to you via cyberspace.
It's better than any Bitcoin,
And please
right?
show it to us once you get it, this virtual check.
Okay, take it. That's it.
Thank you so much.
Wow.
Serious business.
That's great. Can you hold it up higher and we will be able to see it?
Music.
Okay.
Yes, thank you so much. We would also like to, are we going to take a photo of this as well? I think the tech team wants us to do a pose.
And you can hold up your check.
Okay. Congratulations to BookDot for winning the 2020 HFA Innovation Challenge with a prize money of $50,000 by Pfizer and a $10,000 Alibaba Cloud credit. Congratulations. We would also like to thank the other finalists as introduced previously by Mr. Shrida. They are Hello Health, TPS Joy ID, Docuity, BookDoc here, Reach 52, and Credify. Thank you all so much for participating in this innovative challenge. And thank you so much to Pfizer and Alibaba Cloud for co-organizing it with FinTech Academy. Finally, thank you so much to our organizers today for really hosting this segment and doing this very interesting and well-organized panel discussion. Over to you, Vincent.
Thank you very much, Jean, and congratulations again. Okay, BookDoc, and thank you so much, for inspiring us, with what's happening in healthcare and fintech. Now we have taken the photos, right? Can I confirm with the support team the photos are done? Yes, I think we are good. Okay, so ladies and gentlemen, okay, thank you for joining us. We are now officially finished with track B of our. We'd like to thank our moderator, Ms. Fu, and our guest panelists again for an amazing and engaging session. I'm just going to quickly share a screen. Okay. Okay. All right. So we've got a second video. Let me quickly share this. Okay. Right. So we have officially finished our track B. For those of you who will be moving on to track D with the topic, how can tech be good for sustainability? Okay. You continue to stay on this virtual page in this virtual room. For those who are moving on to track C, the topic being FinTech for financial inclusion, real or myth, you can use the reception page to get there. We're going to be starting the next session soon. So thank you for your patience, and I'll see you all in the next session.
Bye.
Bye. Bye, everyone. Hello. Hi, just can I just quickly check that the panelists and the moderator for track D is in? Can you give me a quick wave?
Hello.
Hi, hi. Just a very, very quick one. Okay, I'd like to make sure that they get the name and their company right. So if you could just right-click on your profile before we start. I believe there are already participants in the room, but just before we start, if you can right-click on your profile and then click on rename, and then put your full name and then the company you represent. So when you speak, they will be able to see and identify with you. Okay. If we could do that, that would be good. Okay. All right. We'll just we'll be starting very shortly. I think there will be more participants basically getting into the different tracks, the different rooms. So just give it maybe about half a minute more, and then we are going to start. Okay. So thank you for your patience. Okay, I think we should be able to start now. Okay, ladies and gentlemen, welcome back. We'll now be commencing the panel for track D, the topic being, how can tech be good for sustainability? We'll first hear from the moderator and the panelists, and towards the end, we'll have the time for Q&A. For the Q&A, please pose your question in the chat function. Let me quickly share a screen. Okay. Okay, so pose your questions for the panelists using the chat function, and please include your name and company. The moderator will select your questions for the panelists to answer live. Okay, so without further ado, it gives me great pleasure to introduce our moderator for this track, Mr. Ong Jin Kiat. Mr. Ong Jin Kiat is the chairman for Zero Waste SG. He's an innovator and pioneer in the green economy with wide experience spanning across the industries of environmental, sustainability, industrial, marine, and petrochemicals. Mr. Ong is the director of Biotech Private Limited and Uniflow Power Singapore Private Limited. He's also a non-executive director in a senior advisory role in Stratcon Singapore Private Limited. Please join me to welcome our moderator, Mr. Ong Jin Kiat. Mr. Ong, over to you.
Vincent, I'm not sure whether he's online because we couldn't. Oh. At least I can't see him online.
Okay. Okay.
I thought I saw him somewhere.
He's on his way. He got lost in the links of sea of links. So
okay. So you see, this forum has got different links going into different rooms and areas. So I will ask the audience to be just patient with us, just a few more minutes while Mr. Ong makes his way to us. Okay. Thank you very much for your patience. So someone is directing Mr. Ong to the right room, to the right link.
Okay, he just came in into the room. So now he's been upgraded to the panelist.
Okay. Okay, Mr. Ong, I have just introduced you as the moderator of our track. And what I'm going to do is I'm going to put up the screen again, showing yourself and the panelists. So can I get you to invite or to introduce the panelists for this track, please, Mr. Ong?
Okay, thank you very much. Apologies for the bit of
Okay.
lateness of my part. Okay, I'm not. There's somebody else, yeah. Okay, never mind. First of our panelists is Edward Sanju. Sanju is, Edward is the regional CEO, striving to establish Sansan, provider of cloud-based contact management and solutions for corporations. In Southeast Asia, he will strengthen the deployment of corporate business contacts, which we obviously know is very important nowadays. Then there's Michelle Woon. Michelle Woon is a sustainability lead for Singapore and Malaysia for Nestle, which is obviously everywhere in the world. She has 13 years of corporate working experience in Nestle Malaysia in the supply chain before becoming the corporate social responsibility manager. And she's been promoted to market project management office lead in 2017 before becoming the sustainability lead for Malaysia and Singapore just recently in October. Then we have Girish Ramachandran. Girish himself is responsible for strategy, growth and business operations in Australia, New Zealand, ASEAN, Greater China and South Korea, obviously a very big area, and was previously the head of TCS Europe, Middle East, Africa and Mediterranean regions and corporate VP in the CEO's office in Mumbai, for which I have actually been in. He also serves on the board of Global Reporting Initiative in Amsterdam, which pioneers global sustainability reporting, and also a recipient of the Frans Bannick Koch Medal from the Mayor of Amsterdam for his service to the city. Then after that, Mr. Chia Boon Chong is the Director of Group Sustainability in Singtel. Obviously, Singtel is very well known in the region now. If you compare from many years, he is the head of Group Sustainability of Singtel, driving a wide range of sustainability and strategic community programs to solidify Singtel's strong corporate sustainability. He's also part of the management committee of the Global Compact Network Singapore, which promotes corporate social responsibility and sustainability. Then Dr. Ronald Chung. Dr. Ronald Chung is the principal solutions architect, smart cities, ASEAN worldwide for Amazon Web Services. AWS is everywhere also. He focuses on creating flexible, sustainable, and scalable solutions with customers to overcome challenges in transforming cities and nations into smarter ones. He was previously in smart space and IoT subject matter expert at the Hitachi Vantara, driving smart city and digital transformation solutions adoption in Hong Kong, Macau, and Taiwan. Quite clearly, quite diverse group of panelists that we have. I would now ask the panelists to introduce themselves and see what their comments are on the subject title, which is how can tech be good sustainability? I think this is also very important for us, because on the panelists, we have people who are now doing things, sustainability work at all kinds of scale. We have heard obviously people talking about what to do and so forth. So these are people who have done, and I'm quite sure that their journey will be very interesting. I would call on Edward. Edward, could you please come on?
Okay. Thank you very much for the introduction. I want to share a screen to actually explain about ourselves a little. So thank you very much for having me here today. And before going into details just want to little bit introduce about ourselves so that people can understand what we're doing. So, so we as a Sansan, our mission is to actually turn encounters into innovation. And to do so, we offer a B2B product. So for those who are not aware, we are a cloud-based contact management tool, which enables like companies to visualize all the connections they have and providing a way to understand who has met whom inside their company by just using business cards as a building block for the service. So customers just needs to scan the cards that they have received as a company, and then we'll turn it into a database so that they can look up and search and also share all the contacts that they have made in the past. We're serving over 6,000 companies across 33 countries. And there are many SME, starting from many SME companies, and also large enterprises are using our service. So today, talking about how tech can actually influence the sustainability activities that companies can take, I want to introduce one topic. So the first thing is this Sansan virtual cards. So from the beginning, we were scanning cards to make this database. But in this like pandemic, and also trying to eliminate the physical paper business cards and changing it into a virtual one. This is a activity that we are taking right now. So if you scan the QR code, even one in the background or the one that I'm presenting right now, you can actually download my contact information, and you can even send back your contact information by scanning, taking a picture with your phone for your like a paper business card that you have. So this is a new way to actually exchange business cards. Actually, it's said that more than 1 billion business cards are printed in US a year. That's a very big number. And this is the thing that we want to like actually change and connect people smarter in the new norm. So that's one action that we are doing. And another one is, so we were dealing with this like paper business card from the beginning. And this is one initiative that we are doing from the real initial moment when we established our company. So I was talking about this like paper business cards, but actually for like for one tree, you can get 39,000 business cards from one tree. And what we were doing is actually, if the users scan business cards into our service, we kind of calculated, and actually we plant trees depending on the usage of our customers. So far, we have planted 7,886 trees from the past. And this means that if you calculate it, you can see how many like business cards is actually stored in the cloud inside Sansan. But the point is, we actually started this from real initial moment after the establishment. Our company was founded in 2007, but we started this 2 years after the establishment when we only had like 40 members inside our company. So the way we knew that we have accountability to actually think about sustainability, and we thought, what's the way to actually tie it into our business and contribute to society or this sustainability? So from the real initial moment, there were so few users, so we couldn't plant that much trees. But right now, it's scaling up, and this initiative is getting bigger. We call this initiative NOW, N-O-W, inside our company. And this means that even if you're small, or it's not the timing when you start these sustainability actions, when you're big or when you get money, it's now when you start it. So these are the initiatives that we are doing towards sustainability. And this was like the ones that I wanted to introduce to the audience today. Yes, so back to you, Jin.
Okay, right. I think that thank you very much. I didn't realize there were so many trees or so many cards. So
Yeah.
Let's go to that's quite amazing. Small things add up to a lot. I think then we'll move on to our next speaker, Michelle from Nestle. Nestle is everywhere in our life from the morning to the evening. Michelle, would you like to come on?
Hi, good afternoon, everyone. Can you hear me?
Yeah.
Yeah, okay, thanks. Thanks, Jean, for the kind remarks, and also, yeah, thanks everyone. So thanks for this great opportunity for me to share a little bit about sustainability in Nestle. So perhaps I will just give an overview of Nestle. Nestle was founded in 1866 by Nestle Henry. It is now the world's largest food and beverage company. We are aspires to unlock the power of food to enhance quality of life for everyone today and for generations to come. Sustainability is actually at the core of Nestle, and this is reflected in our continuous improvement mindset and embedded in our creating shared value, or we call CSV approach. And we don't see sustainability as a set of actions or tasks to be done, but instead it is the approach we take to strengthen our business. And we all understand that we need to accelerate because we need to transform. And I guess every one of us aware that climate change is one of the society's greatest challenges. Yeah, it is also one of the greatest risks to the future of our business. Solving it requires all of us here to act with great urgency. And globally, I'm sure maybe some of you may heard it before. Last week, we have just made an announcement on our sustainability commitment to achieve a net zero greenhouse gas emissions by 2050, half by 2030, and we are making our footprint more transparent, and also will make our progress clearer to the public. Yeah. And in terms of financial wise, we are planning to spend about Swiss franc 3.2 billion over 5 years on improving our climate footprint as well. And as I mentioned earlier, sustainability is not something new to us. It is actually continuous improvement of creating shared value. And CSV is actually an integrated part of our business strategy and the way we connect with our society across the value chain, creating a sustainable benefits for all. And Nestle, we are as a food and beverage company that is reliant very much on agriculture, and we take our resources from the earth, water, soil health, and air quality are all essential for our operations. So without a good ingredients, we will no longer be able to produce a high quality products. So that's why the impacts is actually go beyond just to enriching our kitchen counters and nutrition. It's actually because Nestle, as what Jean mentioned, Nestle is from morning until night. We are actually touches the lives of billions of people daily around the world, from our farmers who grow the ingredients to our consumer. I guess maybe some of you here may consume our products, and also surrounding our surrounding communities as well. Yeah, so it's just a brief intro of my introduction.
Okay, thank you very much. Very interesting because, we take farmers for granted. Obviously, without realizing how important, and obviously this COVID-19 has realized that, we need to get to the farmers, and, Singapore has suddenly panicked and said, well, we better set our, increase our food import, to 30% by 2030. And previously, Singapore took it for granted that, well, don't worry, we can import from everywhere. So when obviously we are focused on that, the supply chain is very, very important. But anyway, that's quite useful to know. So we'll move on to Girish. Now, Tata is actually quite well known. Sustainable goodness is one of the long-time slogans, a long time ago, from more than 100 years. Girish, would you like to come on?
Thank you very much. Let me give you some perspective about what I see happening in a post-COVID world. Okay. So some generic trends that I see in ASEAN. The first and foremost thing, obviously all of us know we are in the industrial revolution 4.0, and ASEAN is going to be at the center of this particular change. And if I look at some major trends which are coming out, the first and foremost trend that I feel is urbanization. Today, 50% of ASEAN's population live in cities. And there is a very good chance that if the trend continues in the next decade or so, this particular urbanization could go up to almost 70%. So that is the first data point which I want to tell you. The second one is, again, I was looking at it, is the whole concept about aging. if you look at ASEAN has got one of the largest population of aged people in the world. Okay, today, if you look at it, the world population of aged population is around 9%, whereas in countries like Singapore, by 2035, we will have almost 27% of Singapore over 65 years, 23% of Thailand who are going to be over 65 years, and 20% of Vietnam going to be over 65 years. Okay, so that is a trend which we'll have to provide for looking at how do people going to live their silver years at the safety of their homes. Okay. The third thing which I want to talk about is the whole concept about job creation. Okay, because of what is happening around the world, we are actually seeing that there is going to be a significant amount of youth unemployment. Okay. So today, ASEAN 6, as they call it, I mean, we have almost 21 million jobs lost because of the pandemic. However, the good news is that new sectors are coming up like health, e-commerce, and this is going to create an additional 100 million new jobs. So that is the opportunity in front of ASEAN. And the last topic which I want to talk about is in the area of food and food security. If you look at it today, more than 14% of population in ASEAN are living below the poverty line. And we have almost around 60 million undernourished people in ASEAN, which is a significant number. Now, if you look at how can technology help in this particular thing, I believe that technology can have some answers for some of this. And we are doing some of this, so I'll talk about what we are doing later, but I want to talk about some solutions what this can provide. We have all pivoted to working on remotely. And because of working remotely, I believe that more and more people can opt to work in a rural area, which means that there could be less pressure on urbanization. So technology could provide some significant help towards the whole concept about urbanization. Similarly, today, if 300 million farmers get digital access, we could generate an additional 500 million tons of food, which will be an additional 200 million worth of revenues. And this could be a significant amount for farming and farmer. And this is significant technology using sensors. TCS today, along with Singapore Management University in Singapore, have created an aging care seniors program, where today we have over 150 homes, HDB homes in Singapore, using non-intrusive sensors and using sensing technology and data analytics. We are able to provide safety to aged community at their home. And we believe that data analytics and IoT sensors could be a significant opportunity for people to live their silver years. And the other one, which I genuinely believe is technologies like digital twin can actually try to help the whole manufacturing ecosystem, but they can significantly reduce your carbon footprint as well. So I believe that technology is going to be at the forefront of this particular change that we are seeing. And it is only in the last year or so. I mean, for example, just like Nestle, we have been in business for 150 years as a group. And we have always been, the Tata Group has always been purpose-led. But only in the last year, the top 200 CEOs of US listed companies came up with a concept that said that we need to go beyond shareholder returns. And for the first time, they adopted what is 5 principles, very interesting principles, generating long-term value for shareholders, delivering value to customers, investing in employees, dealing fairly with suppliers, as well as supporting communities. And I believe that we all need to pivot towards that. Purpose goes in the front. I believe that we will be in a position to actually move this discussion forward. Thank you very much.
Thank you, Girish. Very interesting. Yes, the Tata Group founders actually had sustainability in its lifeblood right from the beginning. That I can attest because I've been there a few times, and my background shows the location of your 300 megawatt hydroelectric plant at Vira. It's wonderful, I have to say that. Okay. Okay, now then we'll move on to Boon Chong, Singtel. This is our giant, original giant, and now obviously faced with many other competitors. And let's see what he has to say. Boon Chong.
Maybe I'll start off with a fun fact. Many of you may not know that Singapore was the first in this part of the world to have telephone services in 1879. So that's 2 years after the phone was invented and 13 years after Nestle was founded. I just found out that it's 1866. Thanks, Michelle. Okay, so really digital and technology, these are really like at the core of the business. We are in the business of communicating, connecting people. And I think Girish has also kind of like spoken about it. Really, we are very excited by 5G, what mobile technology can bring, can help in the area of sustainability. So 5G, IoT, data.
Boon Chong, sorry to interrupt you, Boon Chong.
Yep.
You're coming across a little bit soft.
Okay.
Yeah.
All right.
So
let me just.
Thank you. Sorry about that.
Thanks for telling me. All right. So I think we are all very excited by what 5G, can bring to the field and how it can help with sustainability. So things like IoT, big data, data analytics, can help, say, with climate risk management. Things like sea level rises, the monitoring of energy use, of carbon footprint. So I think the opportunity is really quite endless. It is really up to the imagination of the user and even service providers like ourselves. I think, of course, as a telco, carbon footprint will be an associated negative that comes with technology. So because of technology, you have all the devices, you have carbon footprint, you have electronic waste. So that will be something that people have to keep in mind while harnessing technology. What can we do to minimize the negative consequences? And also, I think for technology, we also think that there is technology for good. So there will be a role for social technology impact startup. So Singtel, we do have a social innovation program called Singtel Future Makers. And for those of you who were actually in this room just before this session, you have come across RIBF2020, so one of the finalists. RIBF2020 is also our Singtel Future Makers alumni. How do we help startups to scale their impact in this area? The last topic that I want to talk about would be the inclusion of vulnerable groups, with technology. So how do we include the vulnerable, the disadvantaged, the seniors, especially the seniors, so that they are not left behind in this digital race? So how do we teach them how to use smartphones? And at the same time, they are also knowledgeable how to protect themselves from, say, online scams, and all the pitfalls. Even for children and youth, how do they protect themselves from cyberbullying? So that will be one area that I think it is important to discuss. Thank you.
Oh, okay, thank you, Boon Chong. Very interesting, long history among our panelists, and obviously now we go down to Dr. Ronald Chung, AWS. Ronald.
Thank you, moderator. So I'm Ronald Chung from AWS, Amazon Web Services. And perhaps you already know, actually, Amazon Web Services is a subsidiary of Amazon. And Amazon is a big box retailer, so that you can do all kinds of online purchase, so that we can deliver the goods to you real quick. And actually, Amazon is being powered by a very large infrastructure for computing services to power up this kind of large scale online purchase platform. So actually, the founder of Amazon realized that we can actually leverage this kind of platform and to empower our customer to benefit from the economy of scale, so that Amazon Web Services can provide on-demand cloud computing platform to support our customers to run their workloads in a flexible, scalable, and sustainable manner. So, well, actually in Amazon, sustainability refers to the ability of a system to continue in perpetuity without causing harm to people, the planet, or economic prosperity. It applies to the design and management of our ecosystem, the cloud, as well as how the cloud ecosystem and AWS services enable customers to advance their own sustainability goals and downstream solutions. And actually on September 19, 2019, Amazon and Global Optimism announced the Climate Pledge, a commitment to meet the Paris Agreement 10 years earlier. That is net zero carbon emission by 2040. 100% renewable energy by 2025 and 50% shipments net zero carbon emission by 2030. And as a result, globally, Amazon has more than 70 renewable energy projects with the capacity to generate over 1,600 megawatt and deliver more than 4.6 million megawatt hour of energy annually. So AWS is investing in large-scale renewable energy projects in electricity grids that power our own data centers, and we are committed to achieve 100% renewable energy usage for our global infrastructure, and we have already exceeded 50% renewable energy usage in 2018. On the other hand, not only using renewable energy, AWS also focus on energy efficiency and continuously innovate in our data center in order to reduce the energy usage and increase operational excellence. AWS infrastructure is actually 3.6 times more energy efficient than the median of the surveyed US enterprise data centers. And AWS essentially performs the same task with an 88% lower carbon footprint. So from that perspective, AWS also help the customers to improve their sustainability profile by running their solutions with deploying or migrating workloads into AWS cloud. We are also a key partner to help our customers to innovate and deliver the same or better outcomes with less wastage of energy or carbon emission. In addition to addressing all these sustainability issues from the angles of renewable energy and energy efficiency, AWS also provide access to large data sets in the cloud that helps researchers and innovators to address a wide range of questions and fosters better understandings and data-driven solutions for sustainability researchers. The AWS Open Data Program covers the cost of the storage required for all these publicly available high-value cloud-optimized data sets and allow anyone to analyze, build service on top of it, and use a broad range of compute and data analytics tools to dissect the data for their needs. AWS launched this program to accelerate the research and the creation of the new applications. And we have one objective in mind here. We want to empower everyone contribute in sustainable research solutions. So that's it from my side here, and back to you, moderator.
Thank you very much. Very interesting. I see on the last part where you were mentioning about getting your other stakeholders on board. That's obviously very important. I think that's one of the questions. Many years ago, I remember that when even ISO was being installed in many companies, there were large companies existing. If you're subcontractor companies, you also must have ISO standards before you can come into my system. So obviously we know now that having ISO is a standard, it's a norm. So obviously it's some kind of work in progress that we have to go through. Now we have a wide range of organization and panelists, but I think every one of these journeys, whether you started 150 years ago, you still have to deal with people. It's not just the technology, and I think that technology is the easy part, so to speak. The other bit that's obviously is the people part. Now in this people part, as we say, we are all here, so we are sort of we are, I guess, convinced we are here. So, you are the crowd that's there. So there's no point going on to the how and why. What I would like to know then, for example, is what are the challenges that some of you may have is, in convincing people or your subcontractors or vendors or other stakeholders in coming on board? Because of course, when the boss says so, everybody say yes, yes, right? So how do you get them engaged? Because if somebody has, well, I have 10 things to do by this week, so I have to do another one more thing, 11 things to do. How do you get this to move along? And it's always a people question. Perhaps Edward, since you're on my screen for some reason, so I guess.
Got it. Yeah. So for us, for example, talking about the virtual cards, that's a new concept that we kind of like brought in recently. But it's how we can actually convince with the value of these like new function or new technologies. Moving from the old traditional way, it makes people like frustrated in some kind of way. But if we use technology, it kind of like opens up another possibility. For example, for our like virtual cards, they can share these contacts among their colleagues. That's one value if you change it into like digitized virtual card. So these like benefits, that's the basic kind of like way to convince people, taking a step forward from the existing kind of like operations that people will do normally. So not only doing for good, but it's good for them too. Making a tie between these two is very important for us, and we keep on mind when we're doing these activities.
See, that's quite interesting. Again, it's all the small little things that adds up to, many hectares of trees been cut down, whether it's going for name cards or toilet paper for that matter. And I think digital has a place because, quite frankly, I have a habit of losing my physical name cards.
Yeah, that's what happens.
Yes. All right, good. Perhaps Michelle would like to add something about what your challenges are.
Sure. Thanks, Jean. Okay, maybe I can give an example because, like, for example, in Nestle, we talk about creating shared value. Maybe in layman terms, it's actually CSR, corporate social responsibility. But in Nestle, we are very specific with creating shared value. Creating shared value means that we are actually creating value to our communities and society, but at the same time, it also brings benefits to our company. So in a way, we actually already convinced the communities and our vendors or our suppliers is actually a win-win situation. That's one thing. So that's part of that's what I mentioned just now. We have, for example, I can just name a few of our initiatives, which is Nestle Chili Club. Okay, I'm not sure whether you have consumed our Maggi chili sauce before. So our Maggi chili sauce, our Maggi chili sauce, just don't look at the bottle itself, but actually the chili sauce is actually produced from we have a program we call Farmer Connect. It's a Nestle Chili Club in Kelantan, which we actually involve about 65 farmers to grow our fresh chilies. And these chilies is actually used in our products. So we are creating shared value. We are creating value to this group of farmers to increase their livelihood. At the same time, we have a very great products to share with our consumer to sell. I have something here to share. This is our new products, Nescafe Kopi Kedah. Okay, this is just launched lately. And I would say that this coffee, the Robusta coffee, is actually from Kedah. Again, we are actually engaged a community, about 200 farmers to produce the coffee bean for us. So these are all a value that we actually share together with our communities. At the same time, it's also to our consumers and to our companies itself. And for example, employees, how we actually tackle in terms of employees wise, we are not asking our employees to voluntarily to do certain things for the company, but we are actually educate and create this kind of awareness to our employees through daily forums or with what we have been doing. And we have one we call Nestle Cares in the company. So for example, we have our beach cleanup program. So we actually engage our employees to come with their families together so that we can actually go to different beaches to do all the cleanup. So this is also part of the way that we actually engage with our employees. Yeah. This is how we actually tackle with our challenges. We always involve our employees, even within our initiatives or activities.
Okay, that's very good. I think that it's good that they actually volunteer themselves. In some companies, I think at the beginning, staff get volunteered, without much of say so. But this engagement is very good for the intra-company, obviously, team spirit. And I also see that's actually excellent that you're doing something in Kedah and Kelantan. I assume it's somewhere in the remote part of Kelantan, one of the villages. And I have been there, and they are very poor. I used to be in KL, and quite frankly, I was teaching in a very Ulu rural school, zinc roof and everything at Ulu Kelantan of Kuala Krai. I can tell you that they were all very poor. All right.
Yeah.
So I think that it's important to show concern, real concern at the community level, because that's where everything comes from. That's actually quite interesting because you're actually going towards regenerative capital, right? Rather than sort of like, slash and burn, so to speak. That's very interesting.
Yeah.
So I think, okay, let's have some words from Girish. Would you like to say something else about the challenges that you might have?
Yes. So the Tata Group, again, since the founder, we had 6 chairmen till date of the 150 years of our history. Okay? And the group and the group philosophy has always been put the society at the center of everything. Okay? And as long as you are able to put the society at the center of your business, and you're able to build a business around them, then automatically you are going to take care of all the stakeholders. So this is again wisdom from the group chairman, the founding chairman, and he put a very interesting structure where the group company, the holding company, is held by 66% by philanthropic trust. So each of us have our own responsibility of making profits, but all the profits we generate goes back to the parent company. And the parent company, since it is held 66% by philanthropic trust, goes back into charitable causes. So that is why there has been a way of giving back to the society, which is pretty much ingrained into the group. Okay. So I strongly believe that you need to put governance mechanisms to ensure that giving becomes part of every organization. And for us to do that, it is also important for us to realize that many organizations look at very narrowly only on their own organization and what can we do. Whereas I believe that we need to start looking at the entire ecosystem. So for example, we need to start looking at not just the society, but also the employees. We need to look beyond employees into their own families. Is there a way that we can work with educational institutions? So if you're able to take the whole value chain of your business and see how you can impact the entire value chain, it makes a lot more impact to the society because it becomes a cascading impact. So that is what I strongly believe that all of us should perhaps imbibe as part of our DNA. Thank you.
Okay. I think as part of DNA, your DNA, very few people know, and I know it. Tata, actually, the group has an annual competition for sustainability projects among its group, and I believe that several dozen companies or people from the companies participate, and some big prize and stuff like that. So it's amazing to see dozens of entries from the group itself. Just encouraged to put in. Okay, good. Well, I see that we have a few questions coming in. That's pretty good. Let's just move on first and we'll address the questions. And Boon Chong, would you like to make some comments about challenges, in the organization and your partners?
Yeah. I thought I wanted to talk about the supply chain that you were.
Oh, okay, go ahead. That's just as important.
Yeah. Okay, so yeah, it is. I've been doing sustainability for 10 years, and to me, sustainable supply chain management is the most difficult topic and the most challenging one to tackle, I feel. It's not an easy one to crack because you're talking about ESG, environmental social governance issues that cut across all suppliers. And like for Singtel, we work with about 7,000 suppliers. So it is about ensuring all suppliers behaving in a responsible way, and looking at ESG matters at their operations. So how do we do that? It's definitely not easy. It is like 80% of our procurement spend make up about top 100 out of the 7,000. So you're looking at the 6,900 plus, the smaller ones that don't make it into our top 10% spend or top 20% spend. And how do we go down, because they are the smaller companies, how do we ensure that they are embracing ESG? So I think that is definitely not an overnight journey. That's something that we are still working very, very hard on.
That's actually quite relevant because the big companies are obviously in a good position to move and do what is necessary. The smaller, not just the SMEs, but there's also the micro SMEs that's like, I'm the driver, I deliver, I make the invoice and everything else. So that's a big challenge of how you can extend help to these people to come on board. And of course, Singapore government has some kind of help, but at the end of the day, they still need to find the time and the resource and the commitment to for that journey. So it is not the easiest. It's something that, they need a helping hand out. And okay, Ronald, would you like to make some comments on the challenges? Because you are in a highly competitive industry.
Thank you, moderator. And actually, I totally agree with you that the challenge most likely is centric around the people mindset. It's very difficult to change people mindset. Based on my experience, like, in the IT industry, most of the customers in the past prefer to deploy their own solutions on premises. And that include installing their own servers, storage, or something like that. But the problem is, they have very good reason with that because they want to have full control. They want to make sure that, everything is secure, everything is protected. But at the same time, it also suffered the problem like they don't know what kind of capacity they need, how many servers is required, what are the computing power required in order to run their solutions. So usually they end up with over provisioning of resources that translate to more electricity consumptions, more air conditioning required, and generate more heat, so on and so forth. So to deal with that, from AWS, we try to say, like Leslie have just mentioned, we try to make sure that we have shared benefits with the customers. So we talk to our customers, address their concerns, like from security angle, deploying workload in cloud is as secure as those running on premises. And also we are pay-per-use model. So they end up with cost saving. And it is also flexible, easily scalable at scale, deployed globally in seconds. So it takes time to change their mindset, but we are pretty sure that the customers, after they go through the cloud journey, they are quite happy with that. But it's just take time to convey this message to them. So in AWS, we constantly run a lot of training programs to convey the message of the benefits of running solutions in cloud and how they can be benefit from it. So this would be one of the angles we try to resolve the challenge.
Okay, that's quite interesting that since you're on screen, and of course the first question is to you, which is like, how is carbon footprint lesser than your competitors? Anyone specific?
Yeah, actually, that one is coming from a research report, and this research report details I can provide it to you later. But basically, the philosophy here is that the strategy that we use is that we try to optimize the efficiency of the workload, by, for instance, like machine learning. Machine learning needs a lot of computing power to run on large data set. You need a lot of storage, and you need a power, and more importantly, the GPU power. And GPU generate massive amount of heat, and therefore it is crucial to optimize those machine learning library. And in AWS, we have our own team of expertise to optimize this kind of workload so that they can be running a lot more efficient. And it is basically up to 40 to 50% more efficient in machine learning, shortening the machine learning training time. So from that angle, it generates lesser carbon footprint. And machine learning is just the tip of the iceberg. So we have a lot of optimizations in our infrastructures, in our underlying services to do the same, to achieve the same goal. And that's how we can bring down the carbon footprint.
I think in industries, one of the things that we would like to know as to how you compare with others, and you mentioned a bit earlier. So how, not just for your industry, for any industry, it's always important to benchmark yourself, or for that matter, be the best of class. That's obviously not something that's been compulsory, but at the last IoT exhibition, which we physical one, I was quite amazed. I think the world was shocked by so many things I know related to ICT. ICT is not my strength. I was like lost, I can tell you that. So benchmarking, at least, although I don't know what you're talking about, if you're telling me that you are awarded best of this and that, is useful. But most of it seem to be coming from the private sector. Would the government sector be useful to come into that? Oh, well, the government says so, and award so and so. Is that more important? In the terms of establishing standards and performances.
So you are asking me?
Yes. What's a comment? Because we want to know, obviously, which and to raise the standard. How do we benchmark, so to speak?
Well, in AWS, we have a certain kind of objective. We set very high bar. And we always say that we are customer obsessed. So we do everything for the good of the customer. So from that angle, we can usually raise the standard for delivering every task. We are sort of less, well, of course, we do have some team to do the benchmark and to see what would be the typical standard for that. But usually, we focus only on ourselves because, well, not because we don't care about the competitor, but if we shift our focus to competitor, we have less resources to focus on doing the customer goodness. So
that's a very good answer.
well, that's actually there is no secret because in AWS we have 14 leadership principles. And customer obsessions is one of the first and foremost important principles that breathe and live with that every day when we work in AWS. And that's why we focus only on our customer, what matters to our customer. And like for the machine learning training kind of stuff, our obsession is to bring down the customer cost. And that translates to the ripple effect of bringing down the energy usage, doing good to the society, and so on and so forth. So that's how we deal with it.
Okay, thank you very much. Okay, the next question is for Michelle. As you can see, there is, whether the program for using chili for farmers in Kelantan, whether that is similar program for other ASEAN countries like Philippines or anywhere. And of course, I think the other one is would NSA be open to sponsorship? I think that's a bit. Michelle?
Yeah. Yes. We have a similar CSV plan in like Philippines, Indonesia, but it's not on chili, but more on the coffee side. Yeah. And the focus is in like, for example, in Philippines, it's actually Mindanao. And for details, you may want to visit our website. Yeah. Nestle Philippines website for more information. Yeah. You can actually check from our website. And then as for the sponsorship, yes, of course, we are actually open for any programs and sponsorship that comes to us, and we will review by case basis. And by all means, if it's we found that we can find a synergy that we can collaborate together, and of course, we are happy to see what can we actually go further with the program. Yeah, please contact us.
Sure. Do you have other places apart from Philippines? Would this be extended to, Myanmar, Thailand, or Indonesia? Do you have a similar program?
Yeah, Indonesia, we do have a coffee as well. Yeah, but so far for Chile, Chile is actually quite specific in our in local, which is in Malaysia. Yeah, and we do have rice in Kedah as well. That one is in Malaysia. Like the infant cereal, the rice is actually from our Kedah. It's from our own Nestle Paddy Cup, we call. Yeah.
Oh, okay. Kedah is known as the rice bowl of Malaysia, and it's very interesting. I still remember my geography. Okay, that's very interesting because again, while we would like people to be farmers and so forth, we have to realize that we have to still bring their standard of living up and not keep them poor. It's just critical, as simple as that. It's for our good. Right. There's another one which I think any of the other panelists have comments on those two questions. The next one is sort of a general one, which is like, what are the biggest challenges in sustainable finance in terms of corporate sponsorship and how startups will collaborate with corporates to fund sustainable projects? This one has a few things inside which I don't quite sometimes agree. The word sustainable finance, and if you leave out the financial controller, then it will be more sustainable. Because I have come across this in my own project. It's sustainable as long as it meets my ROI. And this is not where obviously even impact investing comes in. Okay, so sometimes it's difficult because corporates will always want to see at what is in it for us. So there has got to be you're obviously not a charity, but there's some good that will return. I wonder if you have any comments on this, and all of you, perhaps Edward, have any comments on this?
Yes, so basically, I think we as a startup took a different way of actually putting our foot in these like a sustainable kind of activities. We first thought we should actually tag with bigger companies that we can do much more bigger kind of activities. So we were like a 40-member team when we started these activities in the real initial moment. But rather than thinking of having this finance or help from big companies, we started by what we can do from that day. So that was a good step. And then actually, if we take step towards it, after that, there are many possibilities that these bigger kind of partnership talks will come into a picture. So rather than thinking about a big hurdle for the beginning, doing step by steps, I think that's the way for the startups to actually start doing. If you're thinking about taking part in this sustainable activities.
I see.
That's my comment.
Yes. Actually, I should start with Michelle earlier. Does Nestle have some kind of collaboration network or something, to do with startups and so forth? Is there some kind of program that Nestle have, Michelle?
You mean like startup?
Yeah. Do you have some kind of program to I suppose get startups moving along? I mean, if you look at it, startups, you have ideation, all this wonderful idea to be sustainable. So you need to mentor them. But of course, that is the talking stage when you need to move it along. Do you have a program?
Yes, we do have. Like, for example, we actually collaborated with our, in one of our project, which is, we do, but it's actually case by case basis. Yeah.
Okay.
Like, for example, we do have one of the program that we actually collaborated with our MPPJ, which is the Petaling Jaya City Council, to launch a recycling program involving some curbside collections and recycling for 2 townships in PJ. So these are the programs that we start off, and we do give some subsidy to this one of the township there, so that, for example, they can actually collect through this, that means it's a collections through the township. Yeah, it's a waste collection.
I see. So it's part of your CSR efforts.
Yeah, correct. It's also one of our plastic waste effort as well.
Oh, okay, that's useful because obviously, your F&B have a lot of plastics, not just yours, but everybody else. Okay.
Yeah.
All right, and then to Girish, perhaps you could make some comment on corporate sponsorship.
Corporate sponsorship, okay. Before that, I wanted to talk a little bit about, you were talking about how can we learn from one another. Okay? I want to take one example because I'm on the board of GRI, and GRI, all the large corporates here, all of you would be actually, you will be filing your sustainability report on GRI standards. Okay? And GRI recently also started off for the SME segment, sustainability reporting, completely on a digital platform. Okay? Now, one of the biggest thing which I believe we need to go towards is the use of data, and how can data be used in the area of sustainability. Okay? So for example, most of us traditionally look at our own industry and see who is if my carbon footprint is X, how is my closest competitor doing in carbon footprint reduction, okay? And in a particular sector. Whereas I genuinely believe that using data, I could perhaps look at maybe my benchmark on a particular segment could be Nestle, because they could be best in class. And I could learn a lot from Nestle in one segment, whereas another segment, maybe Singtel will be the best in class. So, I believe that the future is all about creating an ecosystem from where we can learn from one another. And the learning need not be in the same sector. So that is what I think, the future of sustainable reporting should be. And we have built in TCS, we have built a very interesting solution which can actually look at each of your activities to go against each of the SDGs, okay, the Sustainable Development Goals, and see how can we map ourselves to each of the SDGs and see who is best in class for each and every SDG. Okay. That is something I think the world has to morph towards. Okay. That's one of the things which I believe. Now, I also saw that there was a question on not just sponsorship, but also what can we learn from the Tata Group. Okay. I want to just give 2-3 examples of something that we have done, and probably some of you can emulate it as well. Okay. We are a large employer. Okay. So TCS, the company that I represent, we have around 460,000 employees worldwide. Okay. And when you talk about the average age of our company, we are around 28. Okay. So that is the average age of the 460,000 people that we employ. Okay. So when we started looking at people who touch 30s and above, we realized that people were sitting in front of computers just like we are all sitting right now for hours and hours. Okay? And by the time they are 30 or 35, you naturally pick lifestyle diseases. Okay? So we felt that as one of the largest employers in the world, we need to see, is there a way by which I can make my employees a lot more healthier. Okay? So I started off this program when I was in India, when I was in the corporate office. Okay? Very interesting program called Fit for Life. Okay? So we married 3 things. One is each of us need to, at the beginning of the year, we need to go and pledge the activity that we will do to keep ourselves fit. So it could be that I say that this year I will run 1,000 kilometers. Or somebody could say that I will do 100 hours of yoga. Okay? You can do whatever your pledge is. Okay? 2, you can't join by yourself. You need to create a community. You need to create at least 3 people so that you're able to influence another 2 more people to be part of your team. Okay? And then at the end of it, what we decide is that we measure everything back into a particular value, and then we give back in charity. So essentially you are marrying your health, your community health, as well as charitable, all the 3 things together. Okay? And this is now the 8th year running. And when I started off, we felt that we will only get around year 1, we thought we'll get 10,000 people. Okay? We got 20,000 people enrolled. Okay? So as we speak, we have 250,000 people enrolled in the program for Fit for Life. And it is the largest health program any corporate does in the world. Okay? And today we have benchmarked it against everybody, and we feel that that is one thing where we can bring it to other people. We have extended the same thing for giving as well. So we do the same concept for the whole concept about volunteering. Okay? So we say that I will volunteer X number of hours this year. And then I say, I can't join by myself. I need to have another 2 more people, and we get another 2 more people together. And then essentially we will do this. So this is a very interesting thing that we have developed. I thought it's good to put it in this forum and see whether people can build it from there.
That's actually very good. I understand this is a form of time banking. So instead of saving money, you are actually putting your time in for the future. All right. So it's a very interesting concept, and I think that's been practiced. It's beginning to be practiced, so that in some places you can volunteer now, and later when people are older, they need help. I need some volunteers. But I think it's quite unique in itself. The Tata Group itself. I had the unusually good experience of meeting a 3rd generation employee, Tata employee. He was very proud of it because he told me, I'm the 3rd generation Tata employee. That's amazing. My son will join Tata, when he graduates from engineering. So that's a very different kind of long-term thinking. The only thing is, of course, one has to be careful about groupthink, as you can imagine. But nonetheless, it does say a lot for the sustainability DNA of the group. Okay.
I had one thing to mention over here. I mean, when you look at the average years a company is listed now in NASDAQ, it has come down progressively to less than 20 years now.
I think that's correct. Yeah,
which means, I mean, there will not be in the same generation. We all have 40 years of working. The future generation will have to move between 2 companies, because if there are no companies which exist beyond 20 years, you will have to keep changing your job. Okay? So organizations who have survived all of this, like for example, Tata Group or Nestle, we've always put purpose in front. Okay? And purpose-led organizations are the ones who survive for a long time. Okay? So sustainability is no longer an option, but that is the only option for you to survive. Okay?
Yes, I think with everyone, living longer, you may end up having two or three careers. And this is, again, another challenge for governments everywhere, along with aging. One of the things I would like to mention is that I'm a member, is that collaboration is very important, especially across the SDGs. So there is a new group, relatively speaking, it's quite young. It's about just less than a year old, called Catalyst 2030. I put a link up. So we are almost all our volunteers. And it's basically how do we collaborate together on pushing up the SDGs. So you or me, by ourselves, we only know that many people or that few people. So if you know more, and there's been several kind of groups that have come up from there. We recently have, we also have a Singapore chapter. There's also an India chapter, Brazil, and so forth. And we had an online also. It was actually co-founded by an Indian lady, Yaru. Very interesting. We have, so there will be country chapters, and I believe there's also a lady in the Philippines. So we will eventually have an ASEAN chapter also, so that everybody comes out together, whether physically or online, to break down silos and reach out. Well, that's Catalyst 2030. It's very easy. It's the right name, actually. The word catalyst is quite important. Okay, let's ask for John Boon's comments, if any, on these challenges. The question moved up.
Yeah. Probably not, but I thought since a couple of comments on Philippines, I thought I wanted to highlight Singtel's regional associate, Globe Telecom in the Philippines. So check out what they are doing, because they are also using technology to help, say, the farmers, the micro enterprises, using a simple mobile platform, but helping them with, say, microfinancing, micro or M-banking and whatnot. I think the world has always been looking to the West, about mobile services, but they actually forgot that within Southeast Asia, we should be very, very proud of our own Globe. Because Globe, they started all the remittance because of their overseas Filipino workers.
Yes.
So they started way ahead before the Western companies. But people just forgot that ASEAN has our own gem. So please go and check out Globe and what they do for all these, the farmers and the small, medium enterprises and micro companies.
Yes, that's actually quite interesting. Of course, Singtel has always been in the lead for telecommunication and sustainability. They are right because I understand that even having a webinar or typing an email creates carbon footprint of its own. One little bit plus if 4 million of us are doing, and then it grows up, and I'm quite sure it's gone up a lot because of COVID. So the thing is, we all need to have we have many issues at hand. So obviously they need to be worked on together. Hopefully, perhaps we can have Ronald perhaps make a comment about the last one, sustainable finance, sponsorship and stuff like that.
Yeah, well, definitely we support our customers and also innovators, ISV, to contribute solutions that is critical and important for sustainability solution. So in AWS, we constantly organize events that with hackathon, and we provide credits to those events so that they can contribute innovative solutions. And also we have also the credit program to support our customers or ISV solutions developer, so that they can try out new idea in a very fast manner. So there has been some success on this. We have some partner who are providing agriculture solutions. They are called the precision agriculture. So they deployed IoT sensors. They set up greenhouse and teach the farmer how to grow the crops in the most effective manner, reducing the water usage and increasing the yield, etc. So they run on AWS Cloud Solutions, and at the start we provide the credit for them so that they can run on the solutions and see how things works out, and that is one important thing that how we support innovation, because in cloud you can start really very small and start the pilot, test out the effect. If it works, then scale it, and eventually the return will come back. But if it fails, you can, well, just scrap it and restart, refine your idea and start it all again. So that is how it plays out in the innovation process. And I believe that it does play an important part for sustainability solution as well.
Okay, yeah, we actually have quite a bit of questions coming up, and in one sense we're also running out of time. There is a question here from Theo about Tata's strong DNA and how do you get our leaders? How does everybody join up through learning? First of all, I do know a little bit about the Tata Group in general. If you look at it, they started by being very sustainable from the founders more than 100 years ago. In fact, the first hydroelectric power station in India and outside of Europe was started by the Tata founders, and that's more than 100 years ago. And of course, they also do it in their daily actions, in everything they do. So in one sense, how do you get the ball started in the first place before it starts rolling? I think that's basically, it starts with the founder. Clearly, the employee is like, well, boss, you tell me what to do. Yeah. So naturally, if you look at it, employees are like children, you're the mom and the dad. So you tell what to do and start the ball rolling, and you have to build it. So it's not a matter of talking about it, but doing it. You have to be seen to be sustainable rather than talk about that. Hope I've answered that, because we do have quite a few questions. All right, so let me see now. I think Hoon has asked for funding for my eco-village in Cambodia. Well, I'm not too sure. Does anybody want to address it? What's the best way to do it? Because it's not just about money. is the balance on environment and society. Have anybody got comments on this? I'm not too sure whether they have name cards over that site, in that sense. But so, what do you think, Edward? How do you? What are your comments? Is it possible for name cards or something in Cambodia?
Yeah, maybe for this one,
quite tough.
Yeah, we're not in a position to like actually support in finance, but maybe thinking about like the environment, thinking about like scan two trees kind of like initiative. Maybe we can put Cambodia as one place that we can start doing those kind of things. So, but I think there might be a more proper person who can actually answer to these questions.
Yeah, I think so.
Yeah.
We don't expect everyone. Perhaps Michelle might do, because again, I'm quite sure that Nestle must be in Cambodia, even though it's not within your purview, so to speak. Perhaps you can take a few comments.
Yeah, sure. I think this is not just on the funding, right? Because I guess the questions is like, is also the best way how to start it is not just about the money, but it's the balance on the environment and society as well. So I would say that maybe I would just give some general example, not just specific on Cambodia. Perhaps I can share a little bit on what we have done. For example, the Safe Water, Safe Communities project. So this is what we actually collaborate together with this Global Peace Foundation. So we have this project is aimed to help address the limited access to clean water in rural disadvantaged Orang Asli communities. So we have this project together with our Global Peace Foundation. So the project is also promote like personal hygiene and also cleanliness through water, sanitations and hygiene wash training. So we do give them trainings, and also we actually help them to install water filter. So these are the projects that we are actually working together with the certain collaborators and to help to how to improve the livelihood in this village. Yeah, this is how we balance environment and society. And maybe there's one more example that I can share on is actually our Keton project. So our Keton project is a recycling initiatives that we work together with Tetra Pak Malaysia, so that we collect and also transforms these carton beverage packs, because we have these cartons, the UBC used beverage cartons, that we actually collect them into a green, then we transform them into a green roofing tiles for them to use. So these roofing tiles then actually donated to these Epic Homes, a social enterprise that construct homes for disadvantaged Orang Asli families as well. So to date, we actually 35 million used beverage carton already collected, I think in 2019. Yeah. So 3,786 roofing tiles and also panel boards were made for this 25 Orang Asli home. So we actually translate this kind of UBC, the used beverage cartons, to their to make a home for the Orang Asli. So this is how we actually balance between. It's not just about funding, but it's also environment and also the society, how we help them. But it's also using our products. And also, while I'm speaking, I want to share something that is like amidst of the pandemic, COVID-19 pandemic. Every one of us need to use mask daily, right? So we actually also thinking of how to actually upcycle our packaging. As you know that we have our global commitment. We want to ensure 100% of our packaging material will be reusable or recyclable by 2025. So one of the initiative that we recently just initiated is actually to work with like a B40 ladies, which is a group of ladies. They are actually below certain incomes. So they need help, they want to raise their income, so that we actually think of how can we actually, you see our packaging material. So after they use the packaging material, they clean and dry it and turn into a mask holder. Yeah. So this is what we have been working with the communities. And this is also one of the example I can share. Yeah. I do not have like something specific in Cambodia, but this is what we are doing in Malaysia. Yeah.
Okay, sorry. Can I say something? Okay, basically what I'm doing is I'm going to create my own eco village, because I haven't seen what is in my head anywhere. Okay, and I just want to raise funding. It's so difficult to get anybody, because when you want to come up with funding, everybody always looks at how much money can I get back. Okay, but I can't give you numbers because if the environment, okay, if we need to care for the environment and people as well. So it's not just about the money. And that's the issue that I am facing, because everybody just, okay, give me your investment deck. But if you don't have the alignment, if you don't understand, it's not just about the money, it's about environment and society as well. Yeah, I'm not going to partner with you because I don't want, okay, I walk the talk, okay, even in my daily life, I reduce waste. And a lot of people don't understand, they're always talking about recycle, but the first word is reduce, right? Like I have been doing my social experiment, okay, for 2 years. I go around in Singapore, okay, I ask people what are the 3 R's. Nobody can, there's only like probably 10% of people that can remember the 3 R's. They only think about recycle. So the first step is awareness. If you're not even aware of what is the problem, how do you make the change? Okay, and I also ask people in Singapore, what happens when you throw something into the rubbish bin? They don't even know.
I think that is part of education.
There's a lot of environmental issues. Yeah, it's all about education, because the level of awareness in going green is so low. Okay, and there's everybody is jumping on eco as a marketing buzzword.
Right. Okay.
Right. So it's just
okay,
eco is a big word. Yeah.
I think
so basically what I want to do, I'm just
I think we
looking
heard
for
enough.
funding and the right people.
Hone, thanks very much. We know that. Okay, thank you for your comments. We're quite aware of that. I think we're looking at it from different angles. I myself have come across that, but let you know that there are people actually doing an eco-village even nearby in Johor Bahru. All right, and in fact, there's something I'm involved in called Kampung Temasek, which is only 30 minutes drive from Johor Bahru towards Pasir Gudang. So these are things that we are working towards. Okay, the fact that you're going to Cambodia is quite interesting, but nearby, even in Johor, there's actually quite a lot of places that needs sustainability projects. Okay, so let us get on to the next thing here. Since we're actually running out of time, just a few minutes more. It's a quick one. Should government be involved in the sustainability and pushing tech for good? Do we need more help from the government? It's always easy to say government, but the government does open our doors. Is any of the panelists have comments? Perhaps any one of you would like to start first?
Yeah, I can. I'm pretty passionate about this. So
okay.
If there are 3 stakeholders which have to come together, okay, I believe it is role of government, the role of enterprises, as well as the role of individuals, or what I call digital citizens or digizens. Okay, all the 3 have to come together. Okay, now when the role of the government in a post-COVID world, I believe, is to create what is called a digital spine. Okay, every country has to try to create a digital spine so that enterprises and people can leverage that digital spine. So it's very important for governments to create that digital spine. Okay, I will give you a simple example. In India, for example, the Indian government built a digital spine. Okay? And Booncheng will understand this better. So the cost of acquiring a customer in a telco is normally around $25. Okay? There was one telco which used the whole concept about eKYC, which was used using this digital spine. And they got 300 million customers at the cost of less than $1 each. Okay, so that is why, and this is going to be very fundamental even for post-COVID in a vaccine world. How do we distribute vaccines? Okay, so I think government has to create that digital infrastructure. Enterprises has to leverage that infrastructure so that we are able to leverage and then we are able to benefit the society. Okay? And all of us individually, citizens, we all need to essentially know that we need to keep reskilling ourselves. It is important that all of us need to understand that we need to reskill and upskill ourselves so that we can leverage on this digital infrastructure. So I believe there are 3 players and all the 3 players have to come together. Thank you.
Okay, that's quite interesting. All right. I think that I would like to have the comments from the other people in a short while, but I would say that we have to look at many ways of solving solutions, and as you have mentioned, cities are going to be bigger, not necessarily better. As people migrate, we need to keep obviously the villages and in the rural communities from migrating, but they are migrating for a simple reason because of opportunities. Having said that, unfortunately, when they migrate to the cities, there's no help. At least I believe that in the villages, they are not going to be, starving. Whereas in the cities, they are just one in a few million people. Nonetheless, we have to look at cities to reduce their energy. If you think about it, we know that Bangkok is sinking, Venice is sinking, and obviously Jakarta is having to shift the entire city as it's the easiest solution. Those by themselves are going to cause a lot of problems anyway. But let's face it, they are in the kind of a lose-lose situation by staying where they are. Now, again, I think that it is quite possible for tech to be used, not just for sustainability, but for growth. All right. Much as there are many big problems, I think then we should start by tackling the smaller problems first. One is not just to talk big. By tackling the small problems, I think we build up the team experience. Okay, corporates will always like to go big, but where do you find the participant, the people? That's my take on that. But I'm finding that a lot of young people are beginning to be very passionate, very concerned, because let's face it, it's going to be their world. All right. So what are we leaving for them, and what do we have? We're going to be spending. Well, that's my grandchildren's, future I'm spending away. So the aspect of taking advantage of natural capital, we have not been paying for natural capital for centuries. So this exploitation has to obviously stop, and we must do better sooner than later. And I'm always reminded of that kind of saying that, after all that's been said and done, more has been said and done. So we need to do more. I would like to invite the panelists to have their last few a minute or so on this topic. Perhaps we can start with, let's start with Ronald, since we're on. Ronald? Your closing remarks?
Yeah, well, thank you. It has been a very fruitful discussion here. And I agree that we need to start small and tackle the problem one at a time. And most important of all, the people have to establish a proper mindset to address all the sustainability concerns and issues. And we are here to help with anything, no matter whether it is a data set perspective, whether there is any existing cloud solutions that you need to look out for migration to AWS. We are always there to provide the suitable solutions for you.
Okay, thank you very much. Panchung, have you anything else?
Me, right? Yep.
Yeah, any last words? Because Singtel is the big the big boy. Still is.
It's a big topic. It's a big issue. No one can do it alone. So it takes collective effort, like what everyone has been pointing out. It takes everyone to work on it. So at the individual level, and even influencing corporates, like for me, I do what I can do at the individual level, and then I try to influence the company and also my network. And keeping in mind, the SDG goals 2030, which is like less than 10 years away. How do we set things into action and get it moving?
Okay, and Girish, some last comments?
Yeah, I think, as we are rebooting, we have a very unique opportunity to reboot with sustainability at the center and having both innovation and technology as the two pillars. And if you're able to build these things together, then I think we will be leaving a much better place for our future generations.
Thank you. That's quite important. Future generations. I think if we cannot be living on spending 3 or 4 more Earths anymore. Michelle, have you got any last words, please?
Yeah, sure. Thanks, Jean. So sustainability and climate change requires joint efforts. So we in Nestle are very committed to it. And we aim to reduce our carbon footprint, and we work jointly together with the public and also the private sector. Yeah.
Okay, good. And last but not least, Edward, you might have the last word on that.
So my words will be pretty similar to yours, like Jin. The responsibility that the company should take, it's pretty much obvious. So people need to think about what kind of even small steps that we can actually contribute to be sustainable. Yeah.
Right.
And today I learned pretty much from the speakers. So that was another thanks to you guys. And it was a wonderful time for me to actually join this session. Thank you very much.
Okay, and we are actually ending on time. Perhaps Vincent, do you want to take over on this part? What's on next? Thank you very much for joining all of us. Panelists, obviously, thank you very much for your insights and comments. We are actually quite engaged in moving forward, and I will contact each of you later. Right.
Thank you, Mr. Ong, and thank you very much to the panelists as well. This has been a mind-blowing discussion for me. I've learned so much. Thank you for sharing so much. It's really well appreciated. We've come to the fun part, that is to take photographs. Okay, so if I can get all the panelists, to come forward, give us your award-winning smile, and hold for the camera. I'll get the support team to take pictures for us. So if you want to do the cheesy thing and put the thumbs up, it's okay as well. If you want to be more serious, that's okay, but I'm going to do the thumbs up. All right, so support team.
Okay, thumbs up.
Thumbs up.
So, ready, smile.
Go.
1, 2. Where's my mouse? 1, 2, 3, smile. Okay, one more time.
Oh, okay.
Don't close your eyes. Ready, 1, 2, 3, smile. Thank you.
Thank you very much.
Thank you.
Excellent, excellent. Okay, ladies and gentlemen, we have completed track D of our forum. Okay, we would like to thank our moderator again, Mr. Ong, and our guest panelists for their informative and engaging session this afternoon. But before we move on to the virtual rooms and the AMA sessions, which is the Ask Me Anything, with Mr. Charlie Young, the futurist, this afternoon, I'll just like just a few minutes of your time to do a quick poll. Just 3 simple questions. Now, the feedback that you provide will help us serve you and create a better event experience for you in the future. So if I can get the support team to run the poll, and I'll get you to, just click on the option. Okay. Okay, so we'll just give it maybe about 30 seconds or so, so that everyone has a chance to input your answer in there. So I encourage you to click on the answer. Just 3 simple questions. Excellent. Okay, we'll give it 10 seconds more. Okay. Okay. I think we have sort of largely finished. So 5 seconds more for anyone who wants to do a last click. Okay. Okay, thank you very much. I'll get the support team to take down the poll. But before we go, I just want to introduce our president for RIBF and the CEO for the ASEAN CSR Network, Mr. Thomas. Invite him to share his thoughts with us in this closing message. So if I can get the support team, his closing message. Thank you.
Hello, everyone. Thank you for staying with us till the end of this forum. It had been a very busy day for nearly 600 participants from all the ASEAN countries and beyond. We deliberated on the theme, All In for Digital Transformation, Revolutionizing Your Purpose for Profit in the New Norm. Throughout the day, we heard that digitalization had been beneficial. It solved many ills of society. It made the world better, convenience, access to better ways of working and living. We learned that it can also make problems of inequalities, social divide, environmental challenges worse if not managed well. It can be a disruptive force as well. In the post-COVID-19 world, we need to get back economic growth, but not growth at all costs. Building back better is the theme we hear. In the sessions, many ideas were proposed. We heard many good examples. We heard many strong commitments. The challenge will be to convert these words into action, action that will maximize benefits and minimize the downsides. We need to keep on learning to do the right thing and to do it the right way. We have looked at 4 areas of great impact from digitalization and the COVID-19 pandemic influence trends. Financial inclusion, healthcare, skills and jobs, and sustainability. These are areas that we have been talking about for a very long time. The weaknesses are now more apparent. They have to be acted on now. The business case is clear, the moral case is clear, the call for action is clear. We clearly need to get things done. We have to organize ourselves to get it done. The ASEAN Responsible and Inclusive Business Alliance, ARIBA, gives us a unique opportunity. I thank the members who are part of ARIBA and who have contributed to and who are still contributing and will continue to contribute to develop a better future for all. If you are not yet a member, please join us. Please sign up at our website, www.ariba.org. We need to act fast, we need to act now, and we need to work together. Finally, in closing, I want to thank Senior Minister of State, Ms. Sim An, all our distinguished speakers, panelists, our valuable sponsors, our supporters, and all of you participants, and the many who worked hard and long to make this forum a success. Thank you, and I wish you all a safe and healthy journey for a better, sustainable, and equitable world for ourselves and our future generations. Let's seize the opportunity now. Thank you very much. Have a good day and a good evening.
Thank you very much again. Thank you very much again, Mr. Thomas. Ladies and gentlemen, thank you once again for joining us in our ASEAN Responsible and Inclusive Business Forum. You could have been anywhere in the world, but you're joining us and we really appreciate your company and we look forward to seeing you again soon. So have a great week. But for those with a network or premium pass, let me just share my screen quickly. You can actually go to one of these sessions, the networking session, or the Ask Me Anything session with Charlie Ang, our Singapore futurist. You can do it through your reception page. So thank you again, everyone. Stay safe. Have a great week ahead and a great weekend, and we hope to see you very soon. Thank you.
Thank you. Bye.
Thank you. Bye-bye.
Thank you.
Thank you, Vincent.
Thank you very much, guys.
Thank you so much.
Thank you.
Hey, how good.
Okay. Let me stop sharing. I think some of the participants have moved on to the networking room. For those that are left, hi. I think it's good. Thank you very much. For the support. It was good. The support team did very well, and I think all the speakers, the panelists, it's just inspirational. I am just gobsmacked by just the wisdom they shared and just the information. Wow, it's really, really good. Okay, so will you guys be closing this room now? Now that the other rooms are open? Support team?
I think we're going to close this room and then because this is the end of the journey for track B. So now it's best to network since you're female holders. Please join. Let me share the link for the networking room on the chat. You hang on a minute.
How do we go to a networking room? I think we have a link.
Yeah.
Migrate.
Yeah, I think there is a reception page, Mr. Ong, that you can just like click and then it actually brings you to the other room.
Okay, I'm sharing on the chat group now. The Zoom link for the networking room. Okay, here you go.
And the other one is from Charlie Yang, right? Yep.
Why is me inside my networking room? Someone kick out.
Okay.
Okay.
Hi, Alvin, are you there? Hi, Ebing, Festus.